put in place.
Okay, so the time frame will be when we have that done?
We're hoping by September to revisit the guidelines with approval. I do have a tentative timeline. Let me, 1 second here. So on the overhead, we have a tentative timeline in place here. So the guidelines itself, in terms of finalization, we're looking at between September and October to finalize those guidelines. Currently, the guidelines we haven't drafted or proposed at this point are on the overhead.
Perfect. There's the neighbor consideration. Sorry, I didn't see that. And I did have one other one, Gail. Sorry, on the percentages on the survey we sent out. So 85% rooftop gardens, or 88%, and then the edible landscaping. So is there been any initiative on the rooftop stuff from the city's perspective? Because I think there was a specific question to the city having those, like I'm thinking Genesis Place or somewhere that would have that kind of opportunity or access to water, those kinds of things.
Back in 2014, when the scope was drafted, we decided to, we targeted 3 projects: the backyard hen program, the on-site, the orchard, the community orchard, and the beekeeping as something that we'd follow through with. We didn't follow through with the rooftop.
Yeah, no, I was just curious as to why, because it said such a high percentage of the community wanted to see it. And with the bees, I guess the other issue is, as you know, we have an issue right now with a hive that's been discovered.
Yes.
I'm a little concerned about that because of the people that are allergic to bee sting and things like that. Based on the videos we've seen of some of the activities surrounding the neighbors, I'm just curious again how that's going to come together, because it looks positive in the report, but I'm quite concerned about, again, the neighbors and where it would be located. And I believe Councillor Coles has a question. Please, Gail, go ahead.
So one of the things that we're certainly looking at doing is another public engagement initiative to gauge public interest in this and support for it. The last one was done in 2013, and since then we have had over 12,000 people join the community. So we really believe that a public engagement initiative to really gauge the interest and to help develop some guidelines is the prudent way to go at this point.
Perfect. Councillor Coulson.
Thank you, Your Worship. So just backing up, the public engagement piece around bees only, or around urban agriculture in its entirety again?
Through the chair, we were looking at just the bees only portion, since we have already developed the first phase of the project, which had the backyard.
Right. So I guess I was going to ask, can we go back to the timeline? So it just sort of seems like finalizing program guidelines. I thought we had already passed that and it was approved previously. So why are we reinventing the wheel and doing it again?
Sorry.
Okay. Through the Mayor, to address the question of Councillor Coulson, we're not going to reinvent the wheel. What we're actually going to do is review the guidelines that were in place previously and see if they still hold up. There's been a significant time gap, as Gail was mentioning, between when we last did the public consultation and developed those guidelines and now, so we're just going to do that. We hope that it's strictly an administrative step.
Okay, because I guess I'm just saying people could have those chickens, you know, this year and have them through the summer and into the winter. We're sort of pushing it back a whole nother year with this guideline, but I'm just a little disappointed to see that, because I was disappointed that the urban agriculture project never went ahead in the first place. And I think we get enough questions and comments about it that maybe, I guess it's a bit late, but there's nothing we can do with that timeline.
Through the Mayor to address the question of Councillor Coulson, and the comment as well, what I actually do want to stress is that there are elements of the urban agriculture project that did go forward, in particular the community orchard. So I do want to stress that there are pieces of it that have moved forward, and it does have some momentum and initiative, where there's been slightly less momentum has been on this. And I think it's a prudent thing for us to go and reevaluate and make sure all of the steps and guidelines that we were anticipating are still correct. We're already advancing into the summer season here. We want to make sure we set up everyone for success and the community overall. So that's part of the reason for taking this prudent step to just take a time, bring the initiative back into public limelight again, prepare appropriate guidelines to move forward.
Okay. So double-edged sword for me. I'm happy to see it come back. I'm just a little disappointed it's going to take that long.
Okay, and any other questions? No, thank you, Gail. Thank you. Stephen, can I get a motion?
Yeah, motion to accept item, would it
5.1.
5.1 still?
Yes. 5.1. All those in favor? It's unanimous. Thank you very much. And I'm not sure who's coming up. Patty's here. Hey, Patty there. Thank you, Clay. So just a quick question as a end result of our meeting with all the agencies, as it relates to that resolution on the funding piece, council was, I believe, it wasn't unanimous, but the majority were supportive of the use of the funding in that direction. The question I have is, when we left that meeting, it seemed that we were going to have more meetings with the agencies to discuss the use of that funding. So do we need to change the way that money's sitting right now, or are the intention is the city's still going to use it for our needs, or we're going to be moving forward and saying to those agencies, you tell us how we should use this in order to better support you? Thank you.
Your Worship, one of the things that we've done actually is put, because it's such a complex piece of information to share, we put it on a video, and so if we may indulge council to just look at that in terms of really explaining how we're moving forward with the social policy framework, and it kind of helps explain the investment that we're doing for, again, the action plans, the next steps towards the domestic violence report after that was done, and so all the next steps that are involved with that, and the piece around the capacity building that we're working with the FCSS funded agencies.
Okay, so but again, I guess the consensus was that they needed to talk some more, is the sort of the gist of it that I got back, Clay. So I'm just curious. So the intent is to meet and then explain, so these one-time funding dollars are going to be utilized in a specific way as per what the bulk of the group want to see, or will it be city-driven? That's I'm just a little concerned, because I would have reevaluated that decision knowing what I know now and how it kind of rolled forward on the one-time funding piece. But I'd be curious to have your response, please.
Through Your Worship, so when we met with the agencies, so it was a cafe-style kind of conversation, and part of what we did was we separated out the different components of the social policy framework to help them really better understand as to what the intent of the capacity building dollars and the action plans related to the domestic violence report and the housing piece, and then as well in terms of the implementation of the youth strategy. What we've learned from the agencies in that conversation was that when they understood the intent, and really at the end of the day, it's support for the development of, again, understanding of how we work together to address complex social issues such as domestic violence and housing, then some agencies were supportive. There were some that still felt at the end that, because of the challenges that they're experiencing today in terms of, again, trying to find, it's a bit of a challenge trying to find funding supports outside in the community, and so there's been some challenges in terms of that, and from what we've heard in terms of feedback from some of the agencies, that they also would like to see that in terms of funding. So
last question, there'll be no expense of that money until we meet with those organizations, correct? So the $330,000 or whatever the one-time funding dollars were, we're meeting with them first, right? I'm talking, sorry, unless you've met with them, have you met since we met with council? Oh, you have met with them. Okay, so sorry, because we had a similar meeting with them as well. Okay, so that was a separate meeting. Okay, so you've met with them, and they're all collectively supportive of the resolution still, of the one-time funding dollars being utilized in the way that was proposed by administration.
Through your worship, so when we spoke with the FCSS funded agencies, again, the majority were supportive of going forward. They understood really the value and the intent of again, working together towards that development of that framework. And I think when we further explained around how it's all connected to, again, the work that we've been doing around again, the assessment of domestic violence and housing and the youth strategy piece.
No, understand that.
They got that part. Again, there's a couple that felt that at that time. I mean, we haven't sort of revisited since then, but there's a couple of agencies who felt that, you know, again, if there's an opportunity where that funding could be used as a sort of like a special project funding, kind of like what we did in the past, and that's another piece that they thought about. I mean, the other piece that we also got from the province is that an opinion from the province in terms of, again, using that funding as special projects funding. And in FCSS, what the province has provided as an opinion is that for them, they support the use of that funding in terms of really developing that framework, because at the end of the day, it's an opportunity to really develop our priorities as community in terms of what are the things that we really want to address in the community, and then look at funding programs after. The province felt that it was quite premature to be using that funding for just projects on the go.
Okay, thank you. Councillor Coulson.
Thank you, Your Worship. So through the chair, the way I understood the report was that the province wanted the municipality to do this footwork, and hopefully more funding would follow out of it. So a long-term goal is basically to have more funding follow by us doing the work.
What the province really is saying is that by working as a community in terms of collaboration, working together to really address some of those community issues, you're better at really getting your efficient use of your resources, including FCSS funding, and being able to now use that information to advocate to other levels of government and other agencies in government to really say, please support this initiative, because now we have a plan. That's what really the province is really stating in that report, is that they're saying it would be advantageous for Airdrie to develop that plan and work with the different stakeholders to address your community issues, and use that to, as you said, advocate for more resources for our community.
So basically, we're pulling together all of our stakeholders into one plan rather than them all having their own individual plans. We could benefit more greatly by doing so. Okay, thank you.
Any other questions from council? Thank you for the time. I appreciate you enlightening me very much. Councillor Coulson, would you mind?
Thank you. Motion to accept item 5.2, Your Worship, for
Thank you.
information.
All those in favor? It's unanimous. Thank you very much. Cruising right along. We're on item number 6, appointments and presentations. Let's see, introductions. Councillor Bellick.
Yeah, thank you, Your Worship. I call upon Sharon to give us a...
Oh, no, I believe I know who's coming. I see Dr. Kine, and I believe
Okay.
Miles Hamilton is coming forward to present, so you can describe the rest if you wouldn't mind.
Great.
Thank you.
So both those gentlemen would come forward, please, and give us a quarterly update on the Airdrie and Area Health Benefits Cooperative.
Well, Your Worship and Council, thank you very much for having us here today, and we really do appreciate the ongoing key support that the city has provided us. We also would like to again acknowledge your vision and sense of responsibility when it comes to this initiative. We see this city as a trailblazer for other communities to follow, resulting in everyone's benefit in the long run. Okay, electronics and I don't really work that well together, so please be patient. Okay, so with ownership comes responsibility, and we all own our own health, and we are making it our responsibility to become Canada's healthiest community. Oh, look at that, I did it. Okay, so the scope of the challenge, this slide gives you an idea of what areas are key to making people sick. And if you run through this slide, you'll see that 75% of this lies within the individual and the community's domain. And in actual fact, only 25% lies within the healthcare system. And the healthcare system is, by the way, something that you pay for as taxpayers, and that we're saying as payers we will now want to start to manage in conjunction with others this system. So when we talk about healthcare and what the health of the community is, we use various measures for this. And I've just put up an example that's been around for quite a while and been present for a number of years. And this is the Alberta Morbidity Index. And this gives us an idea of what the burden of health and poor health is. And basically, the lower the number, the better the health. And if you look at Airdrie, which is listed up there, back in 2003, we see we're at 0.78, and now most recently at 2015, we're at 0.87. So we are actually going in the wrong direction, and probably a significant portion of the reason for the wrong direction probably represented some of the health services gaps that we've had over the years, namely access to primary care and 24/7 urgent care and that sort of thing. So the expectation is that we should be able to reverse this trend with this initiative. So when it comes to figuring out, are we making a difference, we have to employ various measures and these additional measures of success. And these measures would take place in four main areas: improved determinants of health. So this encompasses the social, physical, and economic environment, as well as the health and healthcare environment and resident health behaviors. So these we would be able to measure over the course of time to see what initiatives, what sort of impact we are having on the baseline. We would be cooperating with the university and others in terms of accessing this information. The next is community and resident engagement. So in this, again, it's easy to measure how are we bringing residents on board, what sort of uptake do we have. So the idea here is, first of all, again, for the health co-op, there would be no fees for membership. That the idea is that that current messaging and involvement through the community, making sure that everyone's involved right from the outset in not only directing how things will go, but also in participating in that movement. The third area for measurement is evidence-informed approaches, and by this we mean what widespread use of evidence-based interventions and approaches will impact the healthcare. So things like, are we doing appropriate screening to pick up early disease? What about early intervention in terms of, again, preventing disease progression? And if there is progression requiring increased health care, what amount can we do for more in-home health care so that people do not have to be transported to hospital? The final area, and this is probably the area where we can get some pretty early returns on this, is improved resource use. Namely, we can realize cost savings, improved resource use, and getting rid of waste and non-value sorts of interventions. by becoming more efficient, for example, in using diagnostics like not doing repeated lab testing when it's not necessary, not having the appropriate person set up for MRI versus any trivial sorts of reasons for getting an MRI. There's already a program out called Choosing Wisely, which is being advanced by the Alberta Medical Association and being endorsed by Alberta Health and Alberta Health Services. And this is directed at improving and reducing waste. And this could realize significant savings. Ultimately, again, the point is this shared vision and mission will result in a win for the community, a win for individuals and families, and a win for stakeholder organizations. Who is at the center? Well, we have the healthy individual and their families, so maintaining healthy individuals and families. And we do this through, again, we talked about watching for the determinants that are within our domain, basically our community and our genetics and our healthy practices, and then maintaining a healthy community that surrounds these healthy individuals. And this occurs with the cooperation of engaged businesses, the community at large, Alberta Health and Health Services, physician group, etc. All of us contribute in this together, so we all have a vested interest, and again, we accept ownership of this initiative. And now what I'd like to do is have Miles give you some idea on what specifically has occurred in terms of establishing things to date.
Thank you, Julian. For this health park to be successful and the health initiative to be successful, we've got to meet the needs of the community. So we've established a partnership committee that involves a cross-section of the community and some senior leaders from healthcare. Those partners will be meeting as a committee starting in July with representation from the City of Airdrie. We've also got representation from Alberta Health and specifically the Assistant to the Deputy Minister, as well as the President of Alberta South, the President Medical Director of Alberta South from AHS. So importantly, we've got Alberta Health and Alberta Health Services at the table, along with our local physicians, the PCN, some of the local health care providers, specifically a pharmacist. We've got representation from the food bank, some business leaders, Thumbs Up, Kim Titus, the founder of Thumbs Up, and of course the CEO, Tom Feasby of the Airdrie and Area Health Benefits Cooperative. So we've got a cross-functional group that is going to work and determine what are the key initiatives that we need in our health park and the services to enhance health. As you can see in the middle slide, there's a lot of areas of health that need to be tackled, from our youth to the disabled, to the frail, the end of life, acute care. Mental health is going to be a big part of this whole project. And there's a lot of work to do in that area. Our doctors are telling us that the area of stress and mental health represents over half of what they're dealing with their patients. And we've seen that I guess, right across Canada, that mental health continues to be a big issue, but it's specifically an issue that we can work on and improve in Airdrie. The members in the partnership certainly will involve all the citizens of Airdrie and the surrounding community, most of Rocky View, local businesses, the schools, the police, the churches, the nonprofits, and those that work in healthcare will all be part of the members in the healthcare cooperative. I want to specifically get into what have we accomplished and where are we at now. Certainly delighted that the 24/7 urgent care has been realized by the community and is open and operating. And there'll be some work with the partnership committee that will be making a further submission on that area of health. Do want to acknowledge the Airdrie Health Foundation. They've been working at this for 5 years, and the work that they have done has been tremendous in moving healthcare forward in the community. We've got our partnership group established. They will be meeting and to move this forward to develop the plan. Our website goes up on June the 12th. That will be available to the community. We've made presentations to the MD of Rocky View. We've got the physicians engaged and involved in the discussions. Really pleased to have Alberta Health and AHS at the table in the partnership committee. That shows their commitment. We've hired our CEO, Dr. Tom Feasby, and he gives his regrets. He was not able to make this date, but he will be at the forthcoming updates. He is a neurologist and the former Dean of Medicine, and very capable in terms of understanding healthcare and healthcare administration. We have identified 4 locations for the health park in Airdrie, and they happen to be in all 4 corners: the northeast, the northwest, the southeast, and the southwest. As we work through this initiative, we'll determine which is the ideal and location. We'll be back to council sometime later in the year with options. And segueing that point, we've just hired a architect, Mark Boutine, from the Mark Boutine Architectural Collaboration, Inc., that's his company name, but he is out of Calgary. They did some urban development in downtown Edmonton. They're doing some urban development and architecture work in Eau Claire in Calgary, and we have hired him to help us with our design and planning of this healthcare park. So we're excited about that. We're working on establishing a foundation. It will probably take 9 to 18 months to get that in place, our foundation. So we've created, we have a partnership with the newly launched Airdrie District Community Foundation, and I know that both Peter and Fred were involved in the launch of that just last week. So we're excited to have the Airdrie Foundation, us being able to partner with the Airdrie Foundation for our fundraising. And I do want to highlight that we have $300,000, just over $300,000 of private money donated to this initiative. Our plan for this year is to raise $2 million by year end, and I'll speak a little bit more to that in a minute on this final page. There's 5 sort of strategic pillars, and I'll read down the right-hand side of the page. There's 5 strategic pillars to our initiative and our deliverables for balance of year. You can see, I'm not going to drain this slide, but you can see what we've been working on and what we're planning to complete in Q2 and Q3. Certainly our focus right now with the partnership group and the work that's being done in the community is to make sure we understand what are the needs of the community. The second step is to integrate the healthcare providers and how we provide these services in a health park. The third point is getting our cooperative up and running and getting our members. This will become very visible in the back half of the year as we initiate our membership drive across the community and across Rocky View. The fourth point is figuring out the health park. What is the right location? What is the size of ground that we need? And what are the services that would be provided in that? So that's happening in parallel with some of the other work that's going on. And then the fifth pillar, and obviously very important as well, is our fundraising. Our plan is to raise $2 million. Cam Clark of Cam Clark Ford is going to be the chair of our fundraising committee. And as I say, we have over $300,000 that have been raised towards that goal. You can appreciate with the architect work and the design work that's being done and the people that are working with us. There's lots of costs associated with this project. It's a big project, but our phase one fundraising goal is $2 million. What we owe, there's two things we still owe the City of Airdrie before we ask for our next round of funding. There's two things that we owe them as part of our agreement. First of all is the final sign-off from Service Alberta. We have got approval on our articles and bylaws. They have been run through AHS, Alberta Health, and Alberta Justice. We're waiting for final sign-off. They've seen the documents. We expect them potentially this week. on our articles and bylaws. So that's the final sign off through the government, and then we should have our D&O insurance finalized by the end of this week as well. So those are the two deliverables that were outstanding. I guess the third one was to get in front of you, and we're here. So we can check that box. So we should have those, and I think Sharon will have those to you. We're hoping by the end of the week.
Excellent. Thanks, Miles.
Yeah, thank you.
Dr. Kine, thank you. Questions from council? Councillor Bellick.
Thank you, through the chair. I'd just like to ask about there was one category in our notes here. It's a title of physician and other practitioner group participation. And we have prepare a proposal for consideration by physicians. Now, that was marked as $0, but I've noticed in other categories when you've had prepared a document such as this, you have charged. So why is the $0 there and not for other categories?
Julian's at those meetings.
Sorry, so I'm sorry, I'm just not, I didn't quite follow.
Okay.
Sorry, could you just?
I think it was on, what page is it on, Daryl?
It's on page
Sorry,
9.
Councillor Bellick.
9 of 28. And it's the third row down.
Page 9. Sorry, the light, I don't have my glasses.
We can turn the lights back on.
So physician and other practitioner group participation, is
Right.
that what we're talking about?
Correct, yes.
Yeah, so $0, that's because the physicians donated their time. It was,
Donated time, okay.
yeah, yeah, so they very generously came out on an evening, on a number of evenings.
Okay. And the next row, which is Alberta Health and Alberta Health Services relationships. Can you give us some examples of the roles and responsibilities of AH and AHS? Just a couple.
So, supporting requests to ministry. So again, sorry, request for
This would be under negotiated partnership
negotiated partnership. Okay, initiate negotiation.
on the same page.
Yeah, so really what's occurred in this situation is again discussing with AHS leadership securing specific individuals that can make decisions right at the partnership committee level so that when we come forward with a proposal, and let's take, for example, let's say we turn around with 24 urgent care and we say, okay, as part of the development above and beyond, because we've all acknowledged that the 724 was the first step accomplished largely through the community and the Airdrie Health Foundation. But above and beyond that, we want to be able to, for example, pay people, residents of Airdrie who need short-term treatment for 2 or 3 days, rather than having them transported to hospital, have them stay here in the community. So we need to have AHS personnel that can, at the partnership committee, say, okay, this is how we can make this happen. And so we have, he's number 2 or 3 in the organization at the table.
Very good, thank you.
Thank you. Deputy Mayor Burley.
It's regarding your morbidity table there. One set of numbers did not make sense to me at all. Airdrie went from 0.78 to 0.87, so we're worsening slightly, like it's increasing.
Yes.
But Didsbury went from under 1 to 1.14, and they have a hospital.
Yes.
How do we...
So again, part of it is I don't have all the information, but I can surmise some of the information if you want. So part of it, I think, would be there were issues around physician supply in Didsbury. They were having an awful lot of trouble through those years getting access to individuals. Plus, the actual hospital has morphed into more of a seniors kind of facility with less and less, arguably, acute care hospital facilities available there. And then finally, and again, I wouldn't be aware of the demographics right off the bat, but depending on the age of the population, if you don't have a lot of new people coming into the community and you have an aging population, the health by definition is going to get worse. So I'm thinking those are some of the factors, but again, I didn't look at the specifics around why Didsbury was moving in that direction. It was really, my expertise would be more with Airdrie.
Thank you. Councillor Hague.
Thank you, Your Worship. So I guess my question would be to our city manager, and in terms of his confidence about the deliverables and them being met. Could he comment on that, please?
Through Your Worship, my confidence. So I am representing the city as part of the partnering group, so I'm getting firsthand, I guess, idea of where the engagement process is at. I think before you, fairly confident in terms of what they submitted last December to council in terms of a business plan. It has changed a little bit, but I think the principles are the same, and they're indicating to you their success or accomplishment of those. The one area, and Mr. Hamilton alluded to it, was the some confirmation from the province that what's occurring is acceptable to them or will be approved in some manner, and that's, I guess we await that. If it doesn't exactly mesh with the agreement we entered into, I think we would have to come back to this group here to ask you if you're satisfied that it's meeting the intent or the direction on behalf of the community. I don't know if that answers your question. I am confident that we will see something from the provincial government. If it's meeting the letter of the grant agreement, that's something that we may or may not have to bring back to you.
Okay.
Councillor Hague.
Thank you. So to follow up, timeline for that?
Our expectation was that we were going to get that document from Service Alberta this week. It's basically been approved. We're just waiting to get the formal response back. And the document's gone back and forth a few times.
Great. So that was the one you were commenting to Sharon about?
Yes.
Okay. Thank you.
That and the D&O insurance. D&O insurance was the second one. That's virtually complete.
Yeah, that's not an issue at all. Yes, Councillor Coulson.
Thank you, Your Worship. So through the chair, I just noticed I was trying to flip back and forth on our presentations this time versus last time. The layout looks the same, but it's a little bit different. So the wording has changed on some of the deliverables and just within this graph that we have. It's too bad that we can't have it up actually right now for the public. But so I'm just wondering where the needs assessment went, because I had read that it was supposed to be Q1 last time. Where are you with the needs assessment and community engagement?
So I would say that's all part of the partnership committee that's moving forward now, and that's where some of our timelines have moved back. You know, we were, I think, overly optimistic with some of our plans earlier in the year. Another one was site selection has been pushed later into the year. But that has just been pushed back. And one of the key issues has been getting the right people at the table for that partnership committee. There's quite a number of folks that, you know, and departments that needed to be comfortable with where we're going, I think, before they came to the partnership committee. And we needed those people on the partnership committee. So I think it's taken a little longer than expected. Our timeline has moved. I'm feeling much more comfortable with what we have in front of you today than what we did, what was almost 6 months ago, as we've got a full-time CEO that's pushing this forward every day. A lot of the committee members are certainly doing it volunteer, but we've now got some people that are pretty much, well, paid people working full-time, maybe full-time or part-time, moving this along.
So there's more than one employee then?
Well, there's a few. We would have, we've got part-time admin. We've got our CEO is part-time. He's not working full-time, Tom Feasby. He's, I'll call it 50% of his time, but we're probably getting 75. We have some support. One of the persons that's done a lot of work is Doug Smith, who's been a consultant, who's done a lot of work and understands Alberta Health, and has done a lot of this work with the different departments in Edmonton. And some of that, the question that was asked earlier, some of those costs come from the work that Doug is doing, getting these initiatives through those departments in Edmonton, doing that groundwork and getting approvals and getting stuff in and out. And some of that stuff goes back and forth between lawyers. So we're paying lawyers to get these documents approved as well.
Okay. So through the chair, when you mentioned the partnership committee, and I saw we saw that slide with all of the members of the community identified. Now, clearly, not all of those people would sit on a partnership committee. So
I would say, well, certainly on the left-hand side of the page, those people are the partnership committee that would be expected to be at the table.
So the numerous community groups weren't really identified, so.
Not every community group would be represented, no.
Okay, so we don't have that list yet then.
We've got the specific persons and names that, maybe we can put that slide up.
Yeah, that'd be great.
Maybe we could help.
It was one of the very first slides, I think.
So if you look at the left-hand side of the slide, the partners that are on that partnership committee, by each one of those bullets and identifiers, there is a specific person that will be sitting at the table.
So
and we have those people established.
I think where Councillor Coulson's going is the community engagement piece. So a lot of the work that Mark Seelan's doing.
Sorry, Your Worship, if I could just finish. Thank you. The community organizations, so is that community links? Is that places that are already providing mental health services, that kind of thing? It's a little bit vague for me when you say you have a committee. You know, we've got the HPCN in brackets invited, so are they for sure on the committee, or they have a representative on the committee? I'm just wondering, what does that committee look like?
So first of all, the community organizations, we have the current head of the Airdrie Food Bank as the representative there. Okay. So the idea with any of these individuals is that they have the connections, the ability to reach out and discuss with the various communities. Because really, given the size of the task, we need someone who is able to champion their particular group and say not only have the expertise and the information from the various stakeholders, but also to bring the message to them and also to encourage and recruit their support. So that's where you have you have to trade off between a manageable partnership committee where decisions can be made and ideas can be brought and coordinated. And then the ability to go back to the various groups.
So as far as other health providers?
So we have, for example, Denise Melrose, who's a longstanding pharmacist here in Airdrie, who has agreed to sit on this committee.
So nobody from Community Links?
No.
Nobody, okay.
No.
And Alberta Health Services, you have two separate.
That's right. So we have.
And they are for sure sitting on the committee.
Absolutely, yeah.
Okay, and who would those individuals be?
So Ted Braun.
Okay.
Who's and the other one is Lara McClelland, who's the assistant to the deputy minister.
Okay. And through the chair, the HPCN, they will have a representative on that committee as well? Okay, thank you.
Thank you. Sorry, further to your point though, that you were going to do more detailed community consultation going forward, and it wasn't really. Okay. Yeah. So, and that was sort of Mark Seelan's piece, was getting that information out there. It had a lot to do with our website, connecting to the community, getting all that information through. Are there any other questions for these gentlemen as it relates to presentation? No, I just want to thank you. Julian, I've been working alongside you now for almost 7 years on different initiatives in the community. This board is made up of nothing but philanthropists, first of all, for their time. The fundraising initiative, I was going to ask you on Rocky View's perspective. So we have another municipal government. They're right next door to us. Where are we with the funds? I know I've talked to the Reeve to say, okay, you're going to be utilizing this facility, so are your residents. So where is that, Miles, if you could?
So we have done the presentation to Rocky View. The formal ask has not happened yet. That will be happening shortly when we pull together our communication package. So we'll be going back to Rocky View for help with this as well.
And you've had some, can you discuss anything with the foundation work or no, as it relates to the ask in Calgary?
Are you talking about, we are, I don't want to get ahead of ourselves, We have done a presentation is done to the Calgary Foundation, and we have a request in front of them, and we hope to get a favorable decision during the month of June.
Excellent. Okay. Sorry, Councillor Coulson.
It just actually brought up something that I remembered seeing the map of what you've identified. So within that map is Crossfield and Irricana. Have you had talks with those municipalities as well?
We have not. We presented to Rocky View, and that's as far as we've gone so far. But as you can appreciate, with our fundraising goal of $2 million, we're going to cast a wide net to go out and get all those constituents. And we expect them to be a part of it because they'll be getting the benefit.
So through the chair, then, do you expect the municipalities to contribute to that $2 million, or would that be separate from that target?
I'm not sure I can answer that question. We certainly are going to Rocky View. I don't see any reason why we wouldn't go back to all the municipalities. Would be consistent with what we've done here. Certainly it's based here in Airdrie, but there would be no reason not to. We haven't actually made that decision yet, if I were to answer that candidly, Candace.
Thank you.
But you have blazed the trail, so we have some leverage, hopefully.
Excellent. Anything else? Seeing no lights on, thank you very much, gentlemen, and thank you for your time. Much appreciated as always. Can I get a motion, Councillor Bellick, please?
Yes, I'd like to make the motion that the council accepts the Airdrie and Area Health Benefits Co-op quarterly report presentation to council as presented.
Excellent. All those in favor? It's unanimous. Thank you very much. Item 6.2, and I believe who's going to be making introductions there? Councillor Haig, please.
Sure, I can do that, Your Worship. Welcome Greg Lockhart up with Tracy With to share with us some survey results previously presented to Community Services Advisory Board.
Although you've left, good evening, Your Worship and members of Council. We're here tonight to present the needs assessment for the survey results for Genesis Place. The intent of the survey was to gather information to determine the nature and extent of satisfaction levels amongst users and non-users of Genesis Place. Administration worked with Bannister Research and Consulting and developed a 6-pillar system for gathering information. The first pillar is the overall quality and satisfaction of programs and services offered at Genesis Place. This would include such things as registered programs, services in aquatics, fitness and leisure, childcare, birthday parties, things like that. The second pillar that we set up was the value for admissions, perception by users and non-users of past value for drop-in 10-time passes, monthly passes, and annual passes for Genesis Place. We also asked the question, should this include incentive programs for annual passes? The third pillar that we designed was regarding knowledge and services provided by Genesis Place staff, and this is overall customer service, as well as the physical facility, maintenance, parking, cleanliness, things like that. The fourth pillar, balance and alignment with the facility schedule. This would include a perception by users and non-users of scheduled versus non-scheduled drop-in times, determining spaces that are available for rental, as well as facility program, and availability of all the amenities. And this was just on an individual basis. I want to make a note, this was not for our user groups for minor hockeys and soccer. This was based on individual use of Genesis Place. The fifth pillar was a demographic, geographic, facility use profile. And the third one was to identify barriers of use, facility schedules, programs, why or why not individuals don't use Genesis Place, to find some trends and patterns and non-use of Genesis Place. So following the presentation, Genesis Place will present a staff agenda report that will include key findings from the survey, as well as objectives and action plans to improve customer satisfaction and answer any questions regarding this presentation. So with that, I'd like to introduce Tracy With, President of Bannister, or Vice President, sorry, I just gave you a promotion there, Tracy. Vice President of Bannister Research and Consulting, to present the results.
Remind me to go back and negotiate my salary after this. I would like it to be noted officially, by the way, that the weather is beautiful today.
I was going to comment, no hail yet, right, Trace?
Yes, wait till Friday. I see it's coming in the forecast.
Oh.
So we're not going to cover the objectives again just because Greg did such a great job of doing that, but I do want to go over some of the specific pieces of what we did in terms of the needs assessment for you this year. So it's really important to note that we did surveys multi-mode, so lots of different methods to make sure we could cover as many individuals as possible. We did some focus groups at Genesis Place that were lots of fun and very interesting to chat with, but we did focus on both pass holders and non-pass holders. Pass holders, we wanted to find out what's going well, what are we doing right, but the non-pass holders, it's What is it? What is it that would give you that little push to become a pass holder in the future? So our methodology included a survey of monthly and annual pass holders. So this was completed in a web-based survey, but we did offer a hard copy option. We didn't want to exclude anybody in terms of preferences for completing the survey. So we had a total of 562 individuals complete the survey online. And this was one of the reasons for the extension in data collection actually over the Christmas season, was because we had such a large response and such interest in the survey that we ended up extending our data collection deadlines. So those of us in the research world get excited about those things, and we extended the data collection into January. There was a public link available as well for the survey through the City of Airdrie website, through which we had 108 participants on that particular survey as well. The target of that was really to ensure that people that aren't necessarily at Genesis Place, we wanted to know why they're not there. So it's not necessarily, again, about who's there and who's happy. It's about who's not there and why aren't they there. We did have a whopping 7 hard copies completed at Genesis Place. So a total of 677 surveys were completed with pass holders. On top of that, we also looked at lapsed pass holders, registrants or drop-in users, as well as spontaneous users and non-users. So in this approach, we went out to the telephone survey. So it was quite interesting because we would phone up a household and say, hi, do you currently use Genesis Place? And they'd say yes, and we'd go, thank you very much, we don't want to talk to you. We were actually looking for non-users in this case. We then drove those users to the other methods that we were collecting their data in. So that was lots of fun. It was kind of like, you're doing the right thing, but we don't want to speak to you, so go do it elsewhere. But then what we did is we also spoke with lapsed pass holders and registrants who basically had experience with Genesis Place but weren't active members. So we had a total of 488 of those do an online survey for us. As well, the public link, when we looked at the website, we had a total of 297 non-pass holders complete the survey. So a total of 984 non-pass holders completed the survey between December and January. So this was an incredibly valuable piece of our research in terms of what we were doing. So we also conducted some focus groups. So after all of that survey work, what we did is we brought in groups of people to sit down and chat with us about why. It's, we had a bit through the survey, but we wanted to do a bit more digging. Why is it? What is it that's preventing you, or what's the barrier to you becoming a pass holder? So we found those at the end of the surveys. People were kind enough to follow through and do some additional work with us and have some conversations on site at Genesis Place. So those were the methods we used, and now we'll get into the findings. So overall, when we look at users, so these would include your pass holders, but would also include what we defined as people that had used the facility 3 or more times per year. Those individuals, 70% of them were satisfied. So when they visited the facility, they gave you ratings of 4 or 5 out of 5 overall. When I look at satisfaction levels for a facility across the province, these are excellent numbers by your users. So it's not a service issue. When I look at this, they're happy. Those that are using are happy with what they're receiving. When we ask them about value for dollar, though, you'll see those that are using are satisfied with the value they're receiving. 84% for annual pass holders. Registered programs are 84%. 10-time pass holders are the same. Monthly pass holders, we have to be careful with this number just because it's a small group, only 23 individuals. But the drop-in users were less satisfied. So that, the bells start going off. Why is it what's preventing those folks? Those who felt that they'd received less value for their money felt that the passes or admissions were too costly. So this was one of the additional pieces that we decided to look at. As well, there was a perception in the conversations during the focus group that admissions were more expensive than other single-use facilities. And I have to be careful with that when I say single-use facilities. Those are not public facilities. Those are other competitive private facilities in a lot of cases. So we're looking at fitness centers or fitness clubs or things like that. So that was where people were saying, I'm not getting as much bang for my buck. Okay. So pass holders, though, felt that they did receive good value, and this is how they define value. So unlimited use of the facility and access to all of the amenities, 20% felt that that was the reason they received value. 18% talked about the cost savings. So what they save by having an annual pass or being a pass holder. What is it, the addition that they get? 17% talked about access to the aquatic area, but 15% also talked about drop-in classes. So those classes are providing that additional value to the pass holders. Barriers, though, cost again was perceived to be the most frequently cited barrier to upgrading to a monthly or annual pass. So we did, again, some additional work on that. However, when we look at the other fitness and recreation offerings in Airdrie, Genesis does provide the best value for the range of facilities and programming within the facility. So to me, there's a bit of a perception issue about what's included when you define value. What do you include in that picture when you look at value? However, we also thought, well, let's find out where they're going. What else are they using? So your competitors, Village Square Leisure Centre in Calgary, in terms of a public facility, as well as Vivo in Calgary. However, there were a large number of single-use facilities that were also mentioned, and these are the private clubs that are competing with Genesis Place. And I was telling Greg actually today when I came in that I caught wind of a study that was done in Edmonton actually in the last month. And the competition in the private fitness has doubled in the past 3 years in Edmonton. And I have no doubt that it's also doubled here in the Calgary region and the Airdrie region as well. So the competition is pretty stiff when you look at private facilities and the offerings and the range of offerings at those facilities. So competition's tough for some of the facility amenities at Genesis Place. So, outside of cost, swimming and aquatics was the most cited reason for visiting the facility. So that's the draw. 14% of those who visit other rec centers, what are they visiting? They're visiting swimming and aquatics. 11% of those would consider using Genesis Place as an alternative, but they talked about the need to refresh the aquatics. So need for newer, different features. We're not talking about building another pool. We're talking about some different amenities and some different options to liven up the pool area. 10%, though, highlighted the need for specific swimming classes or lessons. There is huge demand for swimming lessons. Don't kid yourself. This is on every public facility that we research, that one of the biggest draws for a membership for some facilities, so Service Place in Edmonton or in St. Albert, they offer preferential registration for people that are pass holders. So the pass holders get a crack at the swimming lessons a day before, and that's a huge value. That's a huge value to them as pass holders. So those are some of the things that come into play. So what are folks using when they're in the facility? Pass holders, top of the heap, are using the fitness center, 87%, and aquatics, 77%. So those are your two biggest draws. Probably not a huge surprise to you. If you've ever been in the facility on a Saturday, I'm pretty sure you'll see where most of the folks are, right? I saw the big eyeballs there, by the way. So yes, huge demand. However, your non-pass holders, what are they using? The biggest draw for your non-pass holders is aquatics, but then dry land fitness and leisure. So that's really interesting. And then it's the arena. So it's a much different use. Your fitness center is being used most heavily by your pass holders, not by your non-pass holders. All right. So overall satisfaction, though, overall satisfaction is high. 78% satisfied with the arena. Fitness center, 76%. Childcare services, 67%. Now you can tell, by the way, that we filtered this by those that are actually using them. So if you don't have a child in childcare, we didn't necessarily ask you if you were satisfied with the service. All right. Dryland, fitness and leisure, 66%, and aquatics. So again, we did some more digging. Those who were dissatisfied, what is it? What is it that they're dissatisfied with? So aquatics, cleanliness, which is, again, tough. If you go in there on a Saturday, you could probably clean those change rooms every 5 minutes. It's hard to keep up. And then large, more spacious change rooms because they're packed. They're cram packed. The fitness center, liven it up, offer me some different offerings, improve the cleanliness, again, in large, more spacious fitness center. Heavily used facilities, you're going to see these common issues. Arena, large, more spacious change rooms, and then more public recreation times, which is interesting. And that's a bit of a rub, because remember, this was individual use, not team use. So there's always that give and take between your team usage in the arena and between your public use. Dryland Fitness and Leisure, though, more public recreation time. So to me, there's a bit of an awareness issue there, because people don't necessarily know when the access is there and what are the things that are offered in there. So, programming. We also dug into programming. 46% of pass holders use the drop-in programs, classes, or activities. So half. Half of the people that have a pass are using a class, are hopping in there. Of those that are at those classes, 78% are satisfied. So that's going well. 25% of pass holders use the registered programming. So why is that only half? And of those, 47% of registered program users were satisfied. And we'll talk about why, because we asked that in the focus groups as well. Lower usage and satisfaction levels are being attributed to the additional cost. So folks are saying, look, I'm a pass holder, I'm already paying for my pass, now I have to pay on top of that for my registered class. So it's a kind of an add up in terms of cumulative cost. However, pass holders who are registered users of the programming, registered program users, felt that it's doing well in terms of the variety of the programming and the quality of instruction. So it's not an issue with the services that are offered, it's the cost. It's the additional cost of the registered program on top of what they're paying. So, in terms of scheduling, always something that you ask. 87% felt that the current hours of operation meet their needs. Of course, those who are looking for different hours are kind of like Goldilocks. It's a little too hot, it's a little too cold, not as much just right. Some would like to be earlier, some would like to be later, and some just want more time on the weekends. So, you know, there's no clear, we need to be open an hour earlier. They're just looking for alternative times. When we ask the pass holders, 32% felt that their needs were not being met with the current facility in terms of drop-in programming. That's a demand issue in a lot of cases. So the drop-in programs that they're offered, they're full when they get there to use them. So they're looking for some additional times in terms of those drop-in programs. But the biggest draw is the swimming lessons. So swimming lessons and aquatic programs or classes are the most often or most frequently being mentioned in terms of being at capacity. But I'm going to be honest with you, every public facility struggles with that. Everybody wants the times for the swim and aquatic. So that's a good thing. They're in demand. But it's tough. It's tough to be able to balance all of those competing individuals looking for those classes. In terms of customer service, 78% of users are happy with the service. So it is not a service issue. If we had something lower than 80%, I would be saying you may have a service issue. That is not the case at Genesis Place. Though customer service would best improve if the staff were more polite and more knowledgeable, but when you look at that, that's actually a relatively small group of people when we look at that. The website, however, was flagged as an area of improvement. It's a tough system to use to register for programs. And if you're not on at the right time, I heard this in the focus groups, you better be on there when that minute opens for those aquatic programs, or else they're full before you blink. So it's pretty important to be in line when those registrations open. So only a fraction of respondents use the Genesis Place or city websites to obtain information about the facility. That is an underutilized communication method. So, I know Greg will speak more to the progress that's happening with that particular item. Are there any questions for our...
Thank you, Tracy, both for the weather and congratulations on your promotion.
Thank you.
Any questions from council for Tracy? No, you're getting off easy tonight.
I know.
I just had one, and I apologize. Sure. I couldn't pull this up on my iPad over the weekend, so I missed this report in great detail. But around the multi-use band, so yes. I come in, I pay one fee, I just go to the gym upstairs. I got a black band on.
Yes.
Where was the numbers on that? Because I didn't see that addressed in, I guess I'll direct it to you, Greg, after, on your sort of outcomes and where you want to be by the third quarter. Is that part of the fees piece, or is it specifically addressed and I missed it? As part of your go forward.
Why don't I finish up with this one, just run through our action plan, and then if you want to get into questions after that regarding structure or anything like that,
fine.
We could do that, if that works with you, Your Worship?
Oh, hold on 1 second.
Okay.
I think Councillor Haig has a question as well. So, Councillor Haig, please.
Thanks to Tracy. So when you talk about people in the aquatics program who are saying that they're full up,
Yes.
are they full up just at the times that are the prime times, or are they full up, full up?
I mean, I have to, we didn't break it down on a class-by-class basis, but there are definitely hot times in terms of the swimming lessons that are being offered. And I know Greg is actually addressing some alternate times that would be offered in terms of the classes, but it's truly just in general, the aquatics, those classes they fill up fast. There's certain ones that are specific high demand that feed, and it's probably the youngest groups that are in that. And then of course it's also I've got 3 kids in swimming lessons, so I want them all at the same time, and we know how hard that is to coordinate those schedules. So there's a bit more complexity to it than just the class I want, but it's more the hot times. Even with the drop-in classes, it's not that the classes aren't offered, it's that the ones they want are full when they want to access them. So it is more of a timing issue, I think, than actually being that high of demand that there shouldn't be more classes offered.
So, through the chair, if I could just elaborate on that. So last report that we wrote for council, if I remember right, the occupancy or capacity rates in the aquatic area was 92 or 93% of our classes are at maximum number of participants. So we're not 100% full number of classes, but our prime time classes do fill up very quickly. Last year when we came to council as well, we presented a staggered registration, which allowed us to only open up certain classes with the intent of more people getting at those classes. So when one person gets in through the internet time, right away be able to log on at 7 o'clock in the morning, they couldn't book up 7 courses because we'd only made 4 available. So the hope was that more people would have that opportunity to get into the classes, not one person getting in and be able to book up 7 or 8. And that has helped us a lot with our waiting list and our classes as well. So we have put those in place probably 10 months, a year ago those started. And that's how we're trying to manage that situation right now. But we are at 92 or 93% capacity on our lessons. When I started here 10 years ago, we offered roughly about 4,000 to 5,000 lessons. We now do 12,700 lessons a year. So demand has more than tripled for lessons and those times. And each area of the pool has to be used for a certain level. It's not like we could take more, for example, sea turtles of the 5-year-olds because they can only get in so much depth of water before they're over their heads and they better know how to swim before we start. So it really, the pool, how the pool is designed is part of it, as well as the number of time. We're also 51%, I believe, for lessons programming time right now of the available time that's available prime time, and we are 49% public use with family swim and public swim as well.
Thank you, Greg. If there's no further questions for Tracy, I'd like a motion, please, Councillor Haig.
I'd like to move that we accept this for information, Your Worship.
Thank you. All those in favor? It's unanimous. Thank you, Tracy. As always, it's a pleasure to see you. Appreciate all the information. We're moving on to 6 point. Deputy Mayor Burley, please.
Thank you, Worship. We have Greg staying up there, and he's going to be presenting the action plan based on the survey.
Feel free to ask him all the tough questions after I run.
If you could start that for me from the beginning, please, Sharon. Oh, not the video. I need the whole presentation first, and then we'll go to the video. Yeah. Oh, you can do this one. So this is a video that we did as part of our communication plan, working with the communications department. Nope, we're going to go to the beginning. Okay, we'll get to that video. Sorry. Right to the very beginning of this slide would be, or this PowerPoint would be great. Thank you. So we will get to the video. We're going to make you wait for that one. So. Again, the purpose of the study was to gather research information and determine the nature and extent of satisfaction levels amongst users and non-users. I think it was really interesting that we actually went out to non-users as to why they didn't use the facility. I won't go through the background information. These are the 6 pillars again that we used, each one of them listed individually up there. So the first one, pillar 1, the overall quality and satisfaction. Overall usage, 70%. Definitely feel there is some room to move on that one. And part of what we've got planned for the communication, as well as some of the things we're going to plan for programming, as you'll see later on here, we're hoping we'll raise this satisfaction level up to where we'd like to see it at the 90s. Pillar 2, the value for admissions. So 77% of facility users felt that Genesis Place offered good to excellent value for their money. The key findings was that registered users, 10-time users, annual pass holders report the highest value, and then the lowest value was the drop-in users. This basically follows our structuring, or price structuring pass, where we said the best value for your dollar is to buy the annual pass, and drop-in fees will be market competitive. Just going through a little bit on that one there, Brooke gave me some information today. Just an example, if you were to use your pass as a family, or sorry, as an adult single pass, if you were to use your pass 100 times in the year, so that would be twice a week, your fees for that, you actually break it down to your annual fees for visiting the pass would be $5.47 per visit. If you were to go on a 200 base, so that's about 4 times a week, you're down to $2.73 per visit is what it would cost you on your annual pass for an adult of $585. So it does show that the value is in the annual pass. Our plans for this, our action plan is, first of all, design and implement a strategic communication plan to support awareness about affordability and value of the annual pass. It's about getting to people to understand that buying the annual pass, again, that 2 visits a year, 52 visits a year, if you can make it 52 times out of 360 days that we are open, that is your break-even point on what you would pay for individual drop-in passes. A second one is presented back to the Community Service Advisory Board and Council, a report to approve the value-added services, incentives, and annual pass holders. I actually have this report on my desk right now. We'll be bringing it back to CSAB soon. The idea for this one is advanced registration or discounted fees for registered programs. We had done this previously when Genesis Place Phase 2 opened up. We didn't follow the right procedures. We made the decision as administratively that this is what we'd like to do, with some feedback from Nucor Marketing at the time, or New Door Marketing at the time. We didn't get it approved, and we've had to change it since then. So this is something we're going to work on. We'll come back to Community Service Board and to Council to see if they're willing to look at some kind of advantages for being a member. Our third pillar, 79% of facility users were satisfied with customer service at Genesis Place. Overall, the service and focus groups, users and non-users indicated frustration with the city webpage, as Tracy mentioned. The biggest concern that we have, and we are definitely aware we've had this concern for a while, is the overall cleanliness of aquatics and fitness, as well as lack of space in the arenas and aquatic change room. So the information indicates Genesis Place admissions need to work on strategies to improve overall communication in regard to internal programming and events, as well as Genesis Place administration needs to review and implement changes for overall facility cleanliness. Our first action plan is to work with corporate communications leadership team to process improve facility communications. Our new software system is going to really be a big help with this. Perfect Mind has been selected, and we've been working with them. They have a really well thought out system as far as communication goes. We can send out automatic renewals to members. We can send out reminders to members that their visas are going to expire in 30 days. Please update the information. We can send out information on events and services that are going on. Our biggest thing right now is that we need to write a program as how we're going to manage that. Every department is very, very excited about being able to do this, and we don't want to start out with bombarding our members with 10 to 12 emails a day from each department as they want to promote their areas. The second one, as Tracy mentioned, is our, we're going to look at opportunities to redirect current resources or costs involved with additional services through outsourcing or current janitorial services. As Tracy mentioned, you could come there on a Saturday afternoon, 2 or 3 o'clock once public swimming is open, and there could be up to 100 or over 100 people in the change room. It is very hard to get in there and do some type of a clean that people will notice 5 minutes later. Currently, right now, our aquatic staff go in and wipe down the counters, check the toilets, stuff like that. We change any consumables that have to be done, and then we work through that way through the day. So we are looking at the opportunities of what it would cost us to bring in more resources to have those an attendant in those bathrooms or those change rooms for 5 or 8 hours a day, and what that would cost us to work that through, or realigning some other resources that we currently have. An idea that we have thought about, we're not sure if we're going to go with yet, but it's something we will definitely look at, is the idea of actually closing down the facility, the change rooms for a period of time, 15 to 20 minutes. That would allow you to go in and do a very thorough clean. Problem with that is it's not very good for customer service. Either you can't leave the pool or you can't get into the pool for those 15 to 20 minutes that it's closed on a regular basis. Not sure that's what we're going to go with, but it is something we're talking about to see how that would work with our users right now and how, the feedback on that. So we'll continue to work on that one. The fourth pillar is the balance and alignment of facility schedule. And overall, the survey indicates a high satisfaction with amenities offered at Genesis Place. 87% of respondents state the current operating hours meet their needs. As Tracy mentioned, most pass holders are likely to use the fitness center, and non-pass holders are more likely to use the aquatic area. So this information indicates that Genesis Place administration needs to work on strategics to support cross-promotion and programming between aquatics, dry land, and leisure to support overall facility use. Our action plan with this one here is working with the fitness and leisure team. What we'd like to do is set up Saturday and Sunday around public swimming times, if we can program some events that would happen in the gym at the same time. For example, whether it's family dodgeball or some kind of family programming where the families don't play together, that is part of the service that you pay for when you come to the facility to use the aquatic center. So we just see if we can get people to come in a half hour, an hour earlier, maybe spend some time in the gym, then go into the pool or go to the gym afterwards and play some games together as well. With the one fee, as everything is paid for, it is included in, so it's just us doing a better job of promoting that dry land and aquatic programming can happen at the same visit. Demographics and geographic profiling, we will continue to do some work on this. There was a lot of information on this one. We haven't had time to really dive into it yet with other stuff that's on our plate. And the biggest one as well, the barriers for use. Preventing customers from purchasing an annual pass. Number one finding was cost affordability. Other one was lack of time. And the last one is lack of interest. And so the question was asked, what would encourage customers to purchase a pass at Genesis Place? If admissions were more affordable, was 35 to 48% of the people. So our objective around this is to come up with a plan as to working with communications and how we can promote that this is an option for family activities. I always use the one, for example, if I was to take 4 people to the movie theater, maybe buy everybody some popcorn and a pop, I'm looking at well over $100 for an hour and 50 minutes of entertainment. I can bring a family of 4 to Genesis Place for 18 hours of entertainment on a Saturday that we're open for $22 or $23.05, I believe is the cost for drop-in. So this really comes down to choices and how do we get people to direct their choices for recreation to Genesis Place for those drop-in opportunities and what they prefer or see as recreation and a good value for their dollar as to where to spend it. So, all right, can we do that video now? I'll really challenge you. So this video was done last year through the communications department. Basically to set it up, we had a family of 4 come in. They were given GoPros and they were set loose. So actually have to go to the file there, Sharon. And it's in that GP annual pass. You can click on the link right there. This is my email. YouTube is what it's a YouTube video. I believe it is. Where's Linda? Oh, second browser in it says open on the bottom left. They said so. There you go. Thank you, Chief. Sorry, just was. So thank you to Linda and the group for the communications. They did that up. I think we can use that to do some marketing and work on the strategic communication plan that we designed. So. So, right, Chair, the last page all I had was the recommendation that Council accept this report for information, and any questions.
Any questions for Mr. Lockhart? Councillor Belloc, please.
Yes, through the chair. Before your presentation, Greg, you mentioned that 51% of the time was for classes and 49% was for public times. So where does the swim clubs fit in there? How do they train and whatever with the three pools that we have right now? Well, 2 pools for the swim clubs.
So through the chair, the swim club would use from 4:30 till 8, I believe it is, every night. They use the lane pool, and we don't do lessons in the lane pool. This programming is done in the leisure pool. So Monday to Friday, that is rented out by the swim club from 4:30 till 8 o'clock, with 1 lane remaining open for members when we have the opportunity to do that.
Okay, and do they ever use the dive tank, the swim clubs?
They do as well. They do some warm up in the dive tank and stuff like that. It's we rotate usage of the dive tank. Again, not many lessons are in the 14 feet of water in the dive tanks, so it is available for the swim club to use between those times.
Great, thank you.
Thank you. Councillor Coulson.
Thank you. Through the chair, I'm always so surprised when I get field trip requests from my children's schools that they're not utilizing Genesis Place during the day. I've been there. It's been fairly empty. Why do you think that is? Why is it that they're going to Village Square? I mean, I know they have the wave pool, but have you spoken to the schools as to why they don't utilize Genesis Place?
Through the chair, we actually have one of our staff members in Fitness and Leisure who is responsible for our partnerships with the schools, and we have almost 5 times as many, not so much field trips, but the active living days. We have done a lot of those this year with the schools here in Airdrie that used to go out of town right from the get-go. I guess the biggest thing with us is they're always looking for something different, and if they can come into Genesis Place to play basketball every day, or they're looking to go, like you said, to the wave pool or something like that. So they take that opportunity, if it's just for leisure fun, the chance to bust them into Calgary to go to the Southland Leisure Center or something like that to use those different amenities in the pool is a big drive for that. We do have someone who looks after that, and we have done very well with them. Youth training, well, we do a lot of weight training with the youth through those active living days. We played Nerf, laser tag and stuff like that. And we've actually looked at archery. We've looked at all kinds of things that we can help the schools out with those active living days to keep them here in Airdrie.
So we're still actively trying to sell ourselves.
And we are doing much better than we were 3 years ago.
Okay. And then on the cleanliness issue, do we have full-time attendants that are in the swimming change rooms on peak times? Or is it just sort of the one attendant that's kind of going around the entire facility?
Through the chair, currently we have one attendant that is looking after the 3 main bathrooms on the street, or what we call our main street, so the 3 public washrooms on a rotational basis. So they're in those bathrooms every 45 minutes to an hour. They're only there for 8 hours a day. The facility is open for 18 hours a day.
So including the swimming, the change rooms?
Yes.
Okay. So have we I saw that that's part of the addressing that coming up. So are we looking at maybe budget increases to have more full-time attendants during those peak hours to keep the facility a little bit cleaner?
Through the chair, yes, we are. I've actually just got a quote from the cleaning company last week, and we're just going to analyze that against what it would cost to have, whether it's our staff or hiring new staff to do that cleaning, or is it cheaper to go through the cleaning company and allow them to do that kind of cleaning for 8 to 5 hours during the week is what I looked at, and 8 hours on weekends. So.
Okay, just because sometimes I go to other facilities on those active living day field trips and things like that, and I see they have staff in those, just specifically in the aquatic area, cleaning up, and it makes a big difference in some of those facilities. That would just be my feedback. And then, did we not used to have pass holders that got to register early? Years ago, like I'm thinking 10 years ago, if I remember right. Okay.
So through the chair, 2011 was the voice I heard.
All right, so happy to see that we're looking at what those implications could mean and going maybe to, if people only want to go swimming, dropping the price, because it is our only option right now in Airdrie to swim. I read that right on the report, correct?
Correct. It
Okay,
is something
thank
we're looking
you.
at. And actually, I'm going to challenge that comment from back there. It was 2009 when we opened up phase 2. We started a program, I guess it would have been about 2011, 2010. We started a program of some membership incentives. And again, we didn't go through the right roads to get that done, and it was removed. That said we're at right now with you're allowed to put your membership on hold for up to 6 months, twice a year maximum, and for a maximum of 6 months, as well as you get 2 courtesy passes when you sign up as a member.
Okay, so I'm happy to see that we're looking at that again. And then I had one last question, if I could find it here. The website. I know you've heard me criticize the Genesis Place website a few times, but anything on that? Are we going to look at a standalone website, or is it still going to be linked through the city?
So through the chair, we have heard lots of feedback about the website. Currently, with Perfect Mind, our plan is to try and hook it up through My Airdrie. So you'll have one account for My Airdrie, and you'll access the Genesis Place, the Perfect Mind website through there to be able to do registrations and stuff like that. So no more needing a PIN number, no more needing to come to us to manage your stuff. You can manage all your information through the My Airdrie account. Hopefully going to drive that membership up as well, and we can do all our communications through there as well.
And then just curious if there is thought to separating from the city website to a standalone website that maybe we would draw more, when we're talking about communications plans and people not knowing what's happening at Genesis Place, that you have dry land and you have aquatics and you can use the whole facility, that would just be my personal opinion. I don't know what the rest of council thinks, but I really think that we should have a ton of traffic going to that website, and we just don't.
Through the chair, we have had those discussions, and we're continuing to have those discussions with IT and the rest of the city for how they would a better way to access Genesis Place if possible.
Thank you.
Thank you. Any comments or questions? I think I'll wait once you establish your pillars, Greg. I'm kind of aligning with the cost. So I'm a little bit, when 35% of their customers say that they can't afford to come, it's a significant number. And I know you're doing comparatives of movie theaters or whatever else, but I think you need to, I'm hoping we're looking more in depth as to specifics as it relates to that, because now we're talking about overall health and wellness and well-being and things of that nature when you're looking at, doing that activity versus something that's active where we're sitting. But go ahead, sir.
So just to, I guess, kind of put a little light on that one. So we have been part of it now with Perfect Mind coming in, and our launch date, which will be coming up in November when that will become available for the public. Without changing our prices, our current process for, I'll use an adult annual pass payment as an example, because a lot of the other facilities, private facilities, don't offer a family type one, so we use an adult one, we can make some comparisons. Our current price for an adult full pass is $546.85. When you purchase that pass, you're asked to pay 15% required down on the purchase date, which is $82.03. And your monthly payment is based over 9 months, which is a $51.65 payment a month. Making no changes to the price, council approves the price. The new software will allow us to do just a basic 12-month payment, same price, $546.85. Your monthly payment will go to $45.57 a month. Doing comparisons around town, and it is really hard to do because, as Tracy mentioned, it is becoming very competitive, and people are playing what I would call the Shaw Telus game. We'll give it to you for $20 this month, but it'll be $80 for the last 6, or we'll give it to you for $35, but it'll be, so it's very hard to come up with a price. Prices in Airdrie for private standalone facilities range from $4.99 biweekly, so $5 or $10 a month, to $185 a month. Genesis Place for that same family pass would sit at $45 a month, all the amenities included for $45.
Yeah, and we have no relative competitor in the game that we're in. So
we don't.
You're talking mainly fitness facilities, I would think. Okay, perfect. Any other questions for Greg? Okay, I believe Deputy Mayor, you have a motion, please.
Thank you, Your Worship. I'd like to make a motion that we accept the Genesis Place Survey Results Action Plan for information.
Excellent, thank you. All those in favor? It's unanimous. We will take a 5-minute recess. Thank you. Please. Thank you very much. We are on 6.3. And introductions, Councillor Coulson, please.
Sorry, Your Worship, I was just taking a drink of water.
No trouble.
We have the Highland Primary Care Network coming up to present to Council tonight.
Okay, I'll get it started. Your Worship, Member of Council, thank you so much for the opportunity to come and do our annual update. This is our third annual, so we really appreciate your time. I'm Micheline Nimick, and I'm the Executive Director of the Highland Primary Care Network. And with me today, I'm very pleased to introduce Dr. Mindy Gotama. She's our Board Chair for the Primary Care Network, and it's great to have her here as well.
Sorry, Micheline, your microphone shut off.
Did it?
There you go.
Okay, there we go.
Thanks.
So we, all of the family physicians in the community in our geographic area, and I'll describe what that is in a second, are part of our members of our board. So we have a non-for-profit board. We're 100% funded by the provincial government, and the non-for-profit board has an agreement with Alberta Health Services to provide enhanced primary care services to this community. So that's what the Highland PCN does. Right now, we were established in 2007, and we're just celebrating our 10th anniversary. Hopefully, we'll do some public kind of publicity around that, probably in the fall. And so 10 years in your community, and what have we done in those 10 years? Oh, there we go. It's very fancy. And so we started in 2007 in our geographic area. There were 24 physicians who initially joined the primary care network, and now we have 72. And part of our mandate is to support our physicians and your physicians in the community with team members to enhance the care that they provide. And we had none to begin with because we had no funding, and now we have 24 plus an administrative team to support them and some administrative team in the offices as well. So we use a concept or a conceptual model that is endorsed by the College of Physicians and Surgeons of Canada. That's called a medical home model, which basically means that our goal is to ensure that every citizen in our area has access to a medical home and to a team of people to best meet their needs. And through that medical home, and otherwise known as a family physician office or an enhanced family physician office, they can be linked to all the services that they need. So it's a concept of an integrated health service, but distributed to the team that you're used to using right now. And so our health team that we have right now in the family physicians' offices are registered nurses, pharmacists, dietitians, and kinesiologists. So some of those team members, I misspoke a little bit, are in the family physician offices, and we also have a little central clinic in Airdrie and a little one in Didsbury as well that we support. This is Dason. He's one of our psychologists in family physician offices and really a great asset to our team. So one of the things that I skipped over and I didn't talk about because I didn't see the slide is what our geographic area is. So we cover from the city of Airdrie boundaries, from the city of Calgary boundary up to Didsbury. So that's our geographic area. And so that's just the background, and I'll come back and give you some of our results in a second. I was going to pass the baton over to Dr. Gotama to just talk about some of the misconceptions you might have about primary care and what we've done to address them.
Your Worship and members of Council, thank you for the opportunity to speak to you this evening. I think I've probably ran into most of you in some capacity over the years, but I'll introduce myself a little bit more. I'm Mindy Gautama. I'm a family physician here in Airdrie, and I've lived in Airdrie and practiced in Airdrie for the last 17 years, and I've been the board chair of the PCN for the last 2 years. I joined the Highland PCN right at its inception, and then joined the board a few years ago, and then became board chair 2 years ago. My term is going to be up actually in October, and Dr. Diane Smith, who is a family physician from Didsbury, is going to be the incoming chair. The reason that I joined the PCN is I'm passionate about preventative medicine and about primary care, and especially in integrating the medical home in my practice. On a personal note, my husband and I have lived in Airdrie since 2000, and when we first moved here, there was one traffic light, and City Hall was on the second floor above where the Sally Ann is now. So you guys have come a long way in that time, for sure. We have 3 children who are all students at St. Martin de Porres High School, and we are quite involved in the community with being on the board of directors for the Airdrie Aces, which I am. We've also helped coach basketball, soccer, hockey in the community for several years, depending on which sports our kids were in. So again, I'm a member of this community, and I'm a physician in this community, and a fair amount of experience here. So I'm going to talk a little bit about common misconceptions in primary care. So one is that there are no family doctors accepting patients. In fact, we have 23 out of the 50 family physicians in Airdrie are currently taking new patients. Just a little bit about that. One of the things that we do refer patients to is if they're having a hard time locating a family doctor, our website, hpcn.ca, is an excellent resource. Also, CalgaryAreaDoctors.com is another excellent resource for accessing a list of current family physicians taking patients. Second, that it takes too long to get in to see my family doctor. So I think I speak for most of my colleagues when I say that we do have same-day or next-day appointments available. We recognize it can take up to 3 days to get in for a routine appointment, but most of us do have appointments day of for anything that is urgent or that needs to be seen that day. And again, I think I speak for my colleagues. Frankly, if somebody has a sick kid or a UTI, we're not going to turn them away. We're going to be able to see them in our clinics. I can never see my family doctor after 4 p.m. So 86% of our member clinics do offer some type of after-hours access for their patients. And again, if you go onto our website, hpcn.ca, you'll be able to find an updated list of clinics that offer after-hours access. Additionally, HealthLink is always available at 811 for any medical advice. We have a Highland PCN physician that's on call 24/7, 365 days a year. And if someone really needs to talk to a physician, in addition to the healthcare advice, they can be asked to be patched through to the Highland PCN on-call physician. I need 2 doctors, one close to work when I work downtown Calgary, and one close to home. We usually do suggest that ideally you should have one family physician that knows your bigger picture and knows your health history and cares about you and your health. I really don't look at my patients as a constellation of symptoms. I know that there's a body and a life around those symptoms that has an impact on their care. So my diabetic patient or my hypertensive patient that has financial insecurity or is fighting constantly with my mother-in-law, well, frankly, I'm not going to be able to address a lot of their medical conditions until I look at some of the other things that are going on in their lives. A lot of my patients have been with me for 17 years, and I've seen them through births, deaths, marriages, divorces, children and grandchildren. And I think that relationship is absolutely invaluable. In the middle of these misconceptions, I'm going to hand it over to Micheline, and she's going to talk about outcomes.
Okay. Okay, so we just back to the health management team, and so those health professionals that I alluded to before. Last year, they had over 15,000 visits, and the types of people that they would see on a regular basis would be people with multiple health issues. So the goal and the intent is to really improve access to primary care by supporting those physicians. If you think about the care that Mindy just described and the kind of support that's required by a family physician, it's really best provided by a team of people. So the other piece that so that's one of our physicians, Dr. El Mazugi at Airdrie Medical Clinic, and one of the things that we support and we fund fairly extensively, it's quite a large portion of our budget, is enhanced screening and prevention in your family physician's office. So we do that by supporting what we call POETs, they're proactive office encounter technicians, and what they do is they help organize your screening and make sure that your screening is done at a regular interval and a regular basis and by your family physician. That's really important to ensure that if there are some things that are going awry, they get caught early and there's an opportunity to prevent things. So we also provide, through the PCN funding and through our funding from the government, quite a few group classes. Most of those are provided at our central clinic, and we do also have a chronic pain clinic that runs once a week and low-risk maternity clinic that's right now running 4 days a week. We do have a teen clinic that's once a week, and they do anybody who presents for as a young person can come on a drop-in basis on Thursdays. So some of the classes that we provide also would be around stress management, nutrition, activity. We do a walking program out of Cross Iron Mills, a whole host of classes. And again, the goal and the intent of those is to help keep people as healthy as possible in the community and help prevent any kind of chronic disease that people may have or multiple illnesses from getting any worse than they are to begin with. So we're happy to take any questions that you may have for us at this time, and that's pretty well all we have for our presentation.
Excellent. Thank you, Micheline. Dr. Katama, thank you. Questions? Yes, Councillor Coulson, please.
Thank you, Your Worship. So through the chair, when my doctor was in Calgary, I've since switched to Airdrie, they were part of the primary care network where you would call the health link, and if you needed to be seen, you could go to an after-hours clinic. So I'm just wondering, has Airdrie thought about that? Is that in the cards, or now that we have urgent care? I know we don't want people going to urgent care when it's not urgent, so just wondering if that's sort of in the wings or not.
So we've had an after-hours programs in our business plan for quite a little while, and we hesitate to implement it fully just because we have, and Corey would know this better than I do, our communications person, but we do have a number of our clinics who provide after-hours support already, and so most clinics have something available for their patients right now. Okay. And so there really isn't a need in this community. There's a lot of access after hours.
Okay, thank you.
Questions? No, yes, Councillor Haig, please.
Just maybe more of a comment. We've been here for 21 plus years, and I remember when there were only a couple doctors. And I think it's great to see that statistic that you put in front of us, even in the last 10 years, what we've been able to attract. And I remember comments made by several members of council as well, too, about what do we do to get doctors here. Well, the good thing to see is that they are here and they're available to people who need them. So thanks for sharing that with us tonight.
Yeah, further to that, we have actually added through our whole PCN, not just in Airdrie, 15 physicians, and even just in the last year. So it's actually a good number now. I think you're fairly well served based on the needs that are there right now.
Sorry, over the 72? 15 over the 72 are included?
No, we had 72 minus 15 last year.
Oh, okay. Sorry, I misunderstood you. It was a long flight this morning. I'm a little punchy. I had the same comments as Councillor Haig. I think this is awesome. But what I like most now, Micheline, and we've talked about it because I've known you for a number of years, is just people being aware of what it is that you do and what people can access once they call you and the services that you can direct them to. It's just seeing that 15,000 visits. really shows me that you're making a significant impact in the community. Word's getting out there. People are knowing what's there and that there are doctors available. Because when I came here, you couldn't get a doctor in 2002. You were just basically sat and waited in the waiting room and hoped somebody would see you. So things have changed significantly. So that says a lot about the community that we have and the health professionals that work here now and the work that you're doing. So thank you. And this is as quiet as I've ever heard Corey before. So he's sitting in the back there, the communications expert, getting off easy tonight. I believe Councillor Coulson has a question.
Thank you, Your Worship. So just upon reflection of the health co-op presentation that we had tonight, I'd just like to ask where is the HPCN, I guess, in regards to that vision? Are you looking forward to joining a working group? Where are you at with that?
So we've met with the, I'm going to call them the co-op because I can't say Airdrie Area Health Benefits Co-op repeatedly, but we've met with them on a number of different occasions. The last meeting was actually with Tom last Monday between Diane, Tom, and I. And essentially, we're happy to collaborate with anyone. We collaborate with all of our member clinics. What we have asked the co-op to provide is some concrete goals and objectives that are in alignment with ours that we can work together in the future. We've also, though, do have a responsibility to our taxpayers and our funders as to entering strategic partnerships that, again, are in alignment with the goals that we have and that we're mandated to have. We have offered to be on the partnership committee as well, and so right now we're in discussions around that.
Okay, thank you.
Dr. Katama, so is Tom going to provide those objectives back to you? Has he got a time frame in mind?
I believe so. He left Friday night for Europe for his 50th wedding anniversary, and so I think when he gets back, we'll maybe touch base. He was going to try and send something out to me before he left, but I think he got a little overwhelmed.
Okay, perfect. No, thank you very much. I see no other lights on. Thank you very much, ladies. Corey, thank you. Can I get a motion, please? I believe Councillor Coulson.
A motion to accept for information, Your Worship.
Thank you. All those in favor? It's unanimous. Thank you. We all know that 6.4 was postponed. Unfortunately, Guy is not available, and he would like to present on behalf of the Calgary, Build Calgary region, so he's not available. We're going to reschedule that. And we have 6.5, and introductions, Councillor Hegg, please.
I'd like Michelle to come forward, please. Talk to us about domestic violence and actions. Thank you.
Good evening, Mayor Brown and members of council. I'd like to introduce a panel of primary service care experts that wanted to have the opportunity this evening to present to council to reassure the community that when incidents of domestic violence occur in the community, there is a continuum of collaborative care that provides for individuals and families' well-being. So this evening, we have with us the team of professionals that consists of being represented by the RCMP commanding officer, Kimberly Pazlowski, Angela Wright, the executive director of Airdrie and District Victims Assistance, and Brenda Hume, the executive director of Community Links. They're going to provide you with information that explains their services and their integrated continuum of care.
Good evening, Your Worship and members of council. My name is Sergeant Kim Pazlowski, and I'm the detachment commander of Airdrie Detachment. Our goal tonight is to explain a chronological outcome of a victim of domestic violence. But when I say chronological, it sounds like it's forward to start to end. That's actually not the case here. It can go, it's almost like a circle. We work together and it can go backwards and forwards. But we're going to start, for sake tonight, with the RCMP. And one of our most important goals here tonight is to advise council and the community that none of the victims we deal with are falling through the cracks. None are left to fend for themselves, and none are left out in the cold with nowhere to be. So The first thing I'd like to address with Council tonight is the RCMP's definition of domestic violence. When a layperson hears the words domestic violence, it comes to mind a violent act, a hitting, a punching, those kinds of things. Our terminology for domestic violence, it encompasses much more than that. It's emotional, it's financial, it's all of those things. Our definition is actually domestic disharmony. What that means is an intimate partner relationship where there's disharmony. So somebody's disagreeing with somebody else. So we get the spectrum from people having an argument about groceries to hospitalization. We treat all of those in a similar manner because the people arguing about groceries, they may end up down that continuum, and we're very alive to the fact that domestic violence is a very high-risk situation, and we can offer supports right from people arguing over groceries to the very scary outcomes. When there's a report saying that Airdrie has 4 times the domestic violence as compared to the other populations, what you're doing is you're comparing our RCMP's domestic violence definition to city police's definition. They're not always the same. Some city police forces encompass familial violence in with domestic violence, and some may not. Some may identify that it's actually a violent act. If you compare RCMP domestic violence statistics to RCMP domestic violence statistics, the statistics in the report was correct. We have 18. The crime rate per 100 or 1,000 people is 18. When you compare it to the other RCMP agencies, both municipal agencies, so cities like Grand Prairie, Fort McMurray, Red Deer, Lloydminster, those kinds of things, we are somewhat higher. So municipal detachments, the average is 14.2. So we're at 18. The average is 14.2. That's a 21% increase over above the other RCMPs that use in the same definition. Not 400%. So 4 times would be 400%. We're at 21. If you compare it to small towns, as well as so all of RCMP jurisdictions, they're at 13.6 out of 1,000. So that's a 24% increase above those small town type things. I'm here to tell you that Airdrie does have a higher proportion of domestic violence, but not 400 times. That higher proportion can be attributed to a number of factors. One of them is that we do have a fairly young population. I'm a mom with kids, and both myself and my husband have jobs. I can tell you that working 2 jobs in this financial situation with kids and everything, my demographic, we tend to that demographic has all of the stressors put around it that can lead to domestic violence. A community with a more retired population has less of those stressors. So potentially the domestic violence issues may be less. There's no fighting over kids because the kids are gone and grown. Part of it is we, in the Airdrie detachment, we are very, very adamant and very, very strong on scoring domestic violence, even those very, very low interactions with the public as domestic violence, because it's important to us. Domestic violence and addressing domestic violence right at the outset is essential in my mind and in our minds and in our working group to address it. Domestic violence is the absolute most risky situation a police officer or a care provider, ADVACs or community links can be involved in. It's risky for the police, it's risky for the victims, it's risky for everyone involved. All of our police officers have extensive training in domestic violence, and I can say with my partners here, all of their employees and workers have significant training. That's essential. People out there, lay people trying to identify and address domestic violence issues, that's a concern because they don't have the training to deal with that kind of high risk and sensitive issues that we have. That was actually a very big piece of discussion that we have had. In the RCMP world, when there is a domestic violence issues, and I'm talking all the way from an argument, or even to the point of if there's an issue with regards to custody. So somebody has a question about their custody battle. That is also defined for us under domestic violence because we want to speak to them and provide them the services. So all the way from there to the serious domestic violence, we treat them very seriously, and we have a number of mechanisms in place for our investigation purposes. I'm not going to get into the specifics of those investigational techniques, but I can tell you that not only is it mandated that we have these investigational techniques, but it's mandated that we also provide them, and Angie's going to talk about safety planning and victim services referrals. We have to provide them in every case. We have to provide victim services referrals because it's not always criminal. There is an element that's potentially non-criminal, but that the community can deal with, and that's where my partners really, they help out all the time, but that's really where they help too. Airdrie, I can tell you that Airdrie has always been at the forefront of domestic violence, addressing domestic violence. It was one of the first communities to have its own domestic violence court back in the day. It's also one of the only communities that has we have three domestic violence members that are specifically, that's all their job is to address domestic violence, making sure that none of those people get fallen through the cracks, and on those high serious domestics that we follow them through. That unit so our three-member unit, they do quality control on all of our domestic violence files, but they also provide very necessary resources for the risky domestic violences with threat assessments and all of those things. I'm going to pass this over to Angie to talk about victim services, which, by the way, we on domestic violence, we always refer to victim services. It's one of our mandates.
Yes, and I can vouch for that. The biggest bulk of our referrals do come from the RCMP. If it's not caught at the first responder level of the officer that goes out to the scene, then the domestic violence unit, when they do their review, they notice that they haven't done the referral to ADVAS, so we will get that referral eventually and provide the supports to the victim. I just wanted to share with you a bit of how ADVAS approaches and supports the domestic violence files collaboratively with our other community partners, such as the two here joining me at the table, to provide the ongoing wraparound supports for victims. ADVAS provides professional and confidential services to the citizens here in Airdrie and the catchment area. We've been in operation since 1995, and we do provide 24/7 support for those crisis response if necessary. The officer touched here on some of the training that their officers go through. I just wanted to mention all staff and volunteers that are involved with ADVAS, we have to have the same enhanced security clearance as the members do at the detachment. We have to complete 70 hours or 35 modules of Solicitor General training. That's before we can even have boots on the ground, if I can call it that. We have ongoing monthly training in the areas of applicable types of crime that we come across, including domestic violence. We're certified in many courses such as first aid, mental health first aid, suicide prevention, nonviolent crisis intervention also, just to name a few. As we mentioned, we get most of our referrals from the RCMP, but we also get those self-referrals from community members, or the referrals could come from community partners, such as Community Links, coming the opposite route, if I can put it that way. Perhaps something has been disclosed through counseling. They'll come through to our office for us to meet with them, and then we'll go grab an officer if it seems criminal in nature. Our primary focus always in dealing with these types of files is the safety and security of the victims. Safety planning is one of the #1 things we do with all domestic files that come in, if they're grocery store related or if they have charges in criminal court. Safety planning is safety planning. It looks the same across the board, and it's emphasized with every office visit we have or every phone call we undertake. A safe place is also utilized for these people. If they do need a safe place to go, we have access to facilities that can utilize that as well. We have constant communication with the Domestic Violence Unit, with the RCMP, to ensure the victim's safety at all times, to provide that emotional support, the court support, recommendations for perhaps mental health diversion, the domestic violence treatment program, which I'm sure Brenda will touch on, other appropriate referrals, and the aftercare for prevention of re-victimization for these victims. Just to touch briefly on the court support program that we do have, it's a big bulk of the work that we do. Victims of Crime Protocol is explained and provided to each victim of domestic violence to let them know their rights through the system, through the process, what they're entitled to through the province of Alberta. We work with the Crown to ensure that the victims' questions are answered, their voices is heard through the process, that they receive court support as well as court preparation if they do have to testify at a trial. Meetings with the Crown and the victims are facilitated through our office. We provide the space for that, and we accompany the victims for that meeting. At any given time, our court program could have 250 to 300 files ongoing through the court system. One of the main sentencing conditions that we do see in the outcome of a domestic file is the condition to attend the mandated domestic violence treatment program or journey of change through Community Links. Part of the collaboration we have with Community Links is once those partners that have been ordered to take that program, we get a referral back from Community Links to make sure the victims on those files are still receiving the proper supports, and we do the partner checks during that time period. So if something is flagged as a risk perhaps that is shared with us, we make sure that either my colleague on the left or my colleague on the right is notified of that, and the appropriate measures are taken if there's a breach or something in that regard. So I can speak on behalf of ADVAS that we're pretty confident, we are confident that the people affected by domestic violence, if they decide to reach out for help, they are receiving a solid response from these 3 organizations. Thank you. Brenda.
And through your worship, I want to say thank you very much for the opportunity to come and present to you today. It's very much appreciated. And as my colleagues had just said, we also believe that a critical area for stopping the cycle of family violence is providing a comprehensive continuum of services to identify those at risk and getting them the right support at the right time, and to prevent the violence from occurring again. A comprehensive approach includes awareness, prevention, intervention, outreach, and enforcement activities to ensure that whatever the stage the family is at, there are supports available to them. For the past 15 years, Community Links continues to work in a collaborative manner with all stakeholders to ensure a victim or an offender receives support in a timely and a holistic manner. We work extremely close with ADVAS, RCMP, Probation, Alberta Health Services, Addiction and Mental Health, Court, Child Family Services, Public Health, Shelters, Airdrie Housing, and the Food Bank. The schools readily call for presentation and assistance in helping students to develop healthy relationships. This includes one-on-one support to groups such as Girls and Guys Circle, Beyond the Hurt, and Roots of Empathy. Community Links has a team of qualified, trained, and professional counselors to meet the needs of the community who are affected by family violence through facilitated individual sessions and/or group work. Counselors provide resources, programs, information, and tools to educate individuals, children, and families that build positive skills, create behavioral changes, reduce family violence occurrences, and to create safe strategies to decrease isolation. It is important to also note that to ensure that we help those who are most vulnerable or impacted by the violence have access to services. Prevention of family violence includes more than strategies that stop violence. We need to be equally focused on giving individuals the knowledge and the skills to develop respectful and healthy relationships throughout their lifetime. Healthy individual and interpersonal relationships are the basis for a safe and strong community. The majority of these skills are learned and reinforced in the home, school, and in the community. Since 2004, Community Links has held a funding agreement via Homefront in Calgary to provide services to court-mandated individuals in regards to family or intimate partner violence. We are guided by the provincial family violence standards, which are led by the Alberta Health Services, in consultation and with the approval of Alberta Health Services Addiction and Mental Health, with Alberta Justice and Solicitor General being a key partner in the provision of treatment services for domestic violence offenders for both men and women. We also take referrals through the family court through Child Family Services. Men and women offenders can also join the program on a voluntary basis. Participants of the program provide financial contribution on a sliding scale. And as mentioned, Community Links was also part of developing the domestic violence court in 2006. Family violence programming for victims began in 2004 as well. Community Links has been committed in supporting victims of family violence to provide through various provincial grants, most recently through the Family and Community Safety Program with the provincial government, and our concerted continued fundraising efforts through community runs, third-party events, corporate support, and working closely with service clubs such as the Rotary Club of Airdrie to continue our support. There is no cost for participants of victims of support. When someone comes into the agency, we assess what's all going on for the individual and family. We do a full screening, safety assessment, treatment, and monitoring of the situation to manage and reduce risk. We connect with our stakeholders to ensure, like Angie said, to do the partner safety checks, which is very important to ensure that everyone is safe. We know the impact of living with family violence situations can have lifelong effects on an individual, challenging their coping skills and compromise their social skills. We provide advocacy, skill development, parent, family, individual, emotional support, resources, financial avenues, basic need assistance, legal support, and safety. Through community financial support, a wellness account was established over 10 years ago through the Rotary Club of Airdrie and a private donor to assist individuals with such supports as respite, childcare, medication, security deposits, help with utilities, transportation, changing of locks, telephone support, gas, food, clothing, rent, school supplies. Up to $6,000 a year is allocated to this fund when funding is available through fundraising. As part of the wellness project, a third stage shelter unit was established through the partnership of Rotary Club of Airdrie and Airdrie Housing. Community Links provides referrals to this unit when it is available to assist those in need of developing and sustaining change in a safe and accessible home. We help individuals to enrich their quality of life by helping them to improve their self-esteem, manage their emotions in a more consistent manner, learning to balance their lives, prevent family violence, understand and deal with self-harm, develop social capacity, develop meaning and purpose, develop optimism, manage separation and divorce, and strengthen their relationships with each other, families, and the community. Our philosophy regarding abusive behaviors is that it is possible to end abuse with acceptance of responsibility, with information, support, and commitment towards healthy interactions. Our programs promote community and social well-being by helping children, youth, and families become aware of their issues, identify goals, and develop strategies that help them feel better about themselves. This, in turn, enhances their lives, relationships, and their sense of belonging. We believe in increased family and community safety. We believe in greater access to resources and supports to strengthen the prevention and addressing the root causes of social and economic challenges. We believe in increasing the protective factors among vulnerable individuals. We also believe in reducing the risk factors among vulnerable individuals. We believe in increasing integration and collaboration among community partners so individuals receive higher quality programs and services that are more coordinated, seamless, and tailored to the needs and that maximize their potential. We believe that prevention resources are integrated across sectors and systems.
Excellent. Thank you, Brenda. Thank you, Angie. Sergeant Pleslovsky, thank you. First of all, thank you for all that you do for our community, to our agencies, and of course our CMP. I love the fact all three of you say partners. So you're integrated, you're one, you're working together to make it happen. You just touch on the geographic area, because this isn't just Airdrie, it's Airdrie and area. So you've got people coming from outside of our community. Was that, I guess the question to administration, maybe to Michelle, is with the specific domestic violence report, and I apologize, I can't quote it, but did it talk about Airdrie and area, or was it specific to our community only?
I believe that the study used statistics provided by the RCMP specifically, and I believe that those statistics were for Airdrie.
Oh, okay.
I think that for the referrals that ADVAS and Community Links, in their referral data, that could be broader than just Airdrie.
Okay,
but it was specific to incidents of domestic violence across the area.
Okay, thank you, Michelle. Deputy Mayor Burley.
Thank you. I love the information. Is there anything within your groups that could hinder your ability to provide the service you do, whether it's manpower, finances, et cetera?
Through your worship, it's always funding. We have 13 counselors right now, and I bet we could add 3 more, at least right away.
Okay, thank you.
Councillor Bellick.
Thank you, through the chair. As a co-chair for the Municipal Policing Advisory Board, I'd just like to thank all 3 partners for the efforts in regards to domestic violence and providing all, I like that word, all victims with some sort of aid. I've heard in the community that some people have got through the cracks, as our CMP has said, and all victims receive some sort of aid, so that's great. And during our meetings, during the Municipal Policing Advisory Board, I was questioning the stats of 400%, so I'm glad that you cleared that up. 21% is all that we're looking at right now. And I've heard through those meetings that any one case can cause a officer up to 4 to 6 hours just to go through that case. And I'd just like you to touch on that about, how crucial it is for a case to go through the ranks before it's come to some sort of conclusion, whether it be positive or negative. I don't know if you can, but if you can just touch on that bit, that'd be great.
I sure can. As I've already explained, domestic violence is one of our highest risk, highest priority calls. We, the RCMP and my detachment takes domestic violence very seriously. It doesn't matter whether it's that argument at the grocery store or that inquiry about child care issues. That even those little calls, they take a long time to investigate, and the reason is we do a complete background check. We speak to the victim. We go to those calls. We make sure that we are there, and even if it's not criminal, we need to get a really great understanding of what's going on so we can refer to our partners, because again, it's at that level when we can stop that domestic violence. We want to stop it before it gets to the far. 4 hours is on your low-end domestic. On your really serious domestic, you're talking 40.
Great, thank you.
Councillor Coulson, please.
Thank you, Worship. Through the chair, I have a few questions. So first, I guess I'll start with our Chief of Police. So when you spoke about the young population and the young demographics we have in Airdrie, and that some domestic violence calls and statistics can be somebody just simply coming to the front desk with a custody order and asking questions about that. So I guess I'm just wondering if the new analytics position that we're filling would be able to identify or break that down a little bit better moving forward for our stats.
I would hesitate to do that. because our definition is so that we can help the victims right from the get-go, right from so breaking out into stats to say who's assaulting who, yeah, I could potentially get you that stat, but then that that makes the victim of the mental abuse less important-ish, and I don't want to do that. That's the important thing, is to get these people help, whether they've been assaulted or whether they just feel scared in their home.
So moving on from that then, I guess, so on Municipal Police Advisory Board, we had talked about the new analytics officer potentially being able to break down some of those calls a little bit better for us, so that we would understand if one domestic violence call which resulted in a robbery charge, which resulted in a domestic violence charge, which resulted in fraud, would be broken down a little bit more in detail, so that we could see that. Is that not the direction that?
So it certainly can, and our analysts certainly can do that. My concern with that is to layer victims, level victims, put them on a scaling.
I definitely understand where you're going.
So
not wanting to rank it.
That would be a myself concern about that. But it certainly, if council did want to have that, we could certainly look at that.
Okay, that could be a question for another time, and maybe vetted through the Police Advisory Board as we hear some of those presentations come back again. And then I guess what really hit home with me was when once again, we heard this in the domestic violence report, that lay people identifying domestic violence issues in our community, and how dangerous, I guess, that can be when we don't have all the facts and all the statistics and all the partners who are working together. So I guess I'm just wondering, we've heard, we need a shelter, we need a shelter. Recently, we had a meeting, and it was identified that the province is not funding specifically women's shelters anymore, or specifically emergency shelters. So could you speak to that a little bit?
I can. So back in 2008, 2009, I have to look it up, the Alberta government did go to a housing first model. They really wanted to look at, again, holistic helping of victims. So the funding lately for shelters has been more to the third stage home. So it's not an emergency shelter, it's a long-term facility, an apartment kind of model. That's what the Alberta government has identified in their document, their 10-year plan of how they wanted to address homelessness and shelter issues.
So I guess moving forward, then, I think my question would sort of go to all three of you. Is that really what Airdrie Housing is doing? Because they have that third stage, a few apartments for third stage, correct?
Through your worship, yes, there is one unit. It's not identified as one in one area. It can shift around depending on when it's available. So that everything has to match. Okay. So the family has to be at a safe place in their lives to be able to access that. Most likely they've gone through the first and second stage shelter, and that family or individual stays connected on a continual basis still with our partners.
Okay, so through the chair, we've heard in the community, really, I guess what people are asking for is that first stage shelter, but the province is no longer building or supporting first stage shelters.
The province is really going to. I can actually pull that report that the province has gone to for the information of council. The province has really identified that housing first is their way, the way forward, the way into the future, to provide that wraparound care for these individuals.
Thank you. So through the chair, going back to staff, that will all be coming as we move forward through this process, correct?
Yes, through the chair, what the study identified was 4 areas of focus as the recommendations. The recommendation related to assessing and studying how the community stakeholders and professionals would best design or plan for the needs that a shelter would provide for safe, secure housing is what the recommendation really prescribes that we start planning for. So it's the study recommendation in that area is saying that the community has to shift to a systemic approach to determining what the best solution would be to provide a housing first approach for people who had experienced domestic violence and wanted to regroup, rebuild their life. So that's what that would be an area of focus.
Okay, so again, back to our appointments through the chair. We're working on it, we're getting there, everybody is together, is that what I'm hearing? That's why you're here this evening. We recognize that we have an issue in our community. It's 25% higher than most others. We're working together.
That's our best strength. That's the only way going forward is working together. Okay. I do have that information. It's called a plan for Alberta. The Alberta Secretariat for Action on Homelessness has identified housing first, and so that's available online and
okay.
Alberta government website.
Okay. Thank you.
Trained individuals working together is really the only way forward, really.
Thank you, Councillor Coulson. Any other questions? Thank you.
So just a comment before I make that motion, Your Worship. Just obviously family violence and is reactive by its very nature, and I know through FCSS funding that the nature of that funding being provided is to be proactive, and that's something that we can all work towards in a community, but there's only so much you can do, I guess, in terms of making awareness and that people have to make their own choices. So again, thank you for working together and providing the services that we need for our community to address this. So that I would move, Your Worship, to accept this report for information.
Thank you, sir. All those in favor? It's unanimous. Thank you. And if you wouldn't mind, ladies, just in case there's someone here that has a public question surrounding domestic violence, just to hang out, that would be great. Thank you very much. If you have to go somewhere, totally understand. So we're moving on to public question period. Invite members of the public to come forward if they have any questions. Welcome.
Good evening, Your Worship, members of council. My name is Chris Gorley, and I live in Kings Heights. I'm here to talk about school buses. We've had a few near miss incidents with school children and buses this past school year. Seems to occur more in the winter months when we have less lighting. Our current bylaw does not allow the flashing lights or the stop arm to be used on school bus when it stops to load and unload students. This subject has been brought to this council twice, May of 2014 and April of 2016, with council voting to accept this for information only. The current bylaw B14-2016, 1401, dated April 14th, states, the operator of a school bus shall not at any time activate alternating red or yellow flashing lights and stop arms on a school bus while the school bus is loading or unloading passengers on a highway within the city except on those highways listed in Schedule C, which is the rural roads. My question is, before I get to my question, in my mind this bylaw needs to be changed. There is zero cost to the taxpayers. Buses are already equipped with this equipment. We just need to change the bylaw. My question to council, and I know you can't answer it tonight, will council look at changing this bylaw, taking into account the risks and benefits to the children of our city? Thank you.
Thank you, Mr. Gorley. So yes, I think it's even come to council before that. I'm not going to put Lauren, I think it was Mark maybe that brought all that detailed information forward on the spot tonight, but if you're okay, can we capture that question and come back to you at the next council meeting or in writing, or how would you like to see that?
Yeah, like I said, I didn't expect an answer tonight.
Okay.
I'm posing the question to council tonight.
Well, I think all the council like the opportunity to review the information that we all agreed was the way it was. There were specific reasons why urban centers don't do it. It actually creates more of a problem according to the research, but I don't want to quote anything tonight. I just wouldn't be accurate in doing so. Okay, thank you, Mr. Gorley. Appreciate you coming forward. Oh, and Lauren, you were hidden behind him. I couldn't pick on you. Great seating selection tonight, sir. Okay. Sorry, Sharon, please.
If I may, Your Worship, is there some type of action you desire from staff on that?
No, I don't think so. What I'll do is I'll have Barbara just request those reports, and I'll forward them by email to all of council for review, if that's all right with council. Okay, thank you. And there being nobody else, we will move on with our agenda. Moving on to 8.1, and we have a public hearing. So we'll obviously hear from administration, have a presentation. We'll then open it up to the rest. I'll ask 3 times if there's anyone in favor, they can come forward and speak. I'll also ask 3 times if there's anyone opposed to coming forward and speak. And when that's completed, I won't close the public hearing in case council has a question for one of those that had spoke for either for and against. And from there, I'm not sure, I believe Will's presenting tonight. Correct. Thank you, Will. Whenever you're ready, sir.
Thank you, Your Worship. Good evening. Good evening, members of council. It's my pleasure to be here this evening, almost, but not quite 1 year to the day after we passed our new land use bylaw to provide our first set of administrative and housekeeping amendments to it. This won't be the last time that you hear from us. Staff will be regularly in front of you to update the land use bylaw to fix these types of errors and inconsistencies and do regular maintenance to the document, so to speak, to make sure that it's working well and aligning with what we intend and helping to provide the best and consistent standards for development in our community. As mentioned, this is a relatively administrative exercise to fix a number of minor errors and inconsistencies, but this is in front of council for a public hearing because included in that are some material changes where there are actual changes and amendments to the bylaw, and we want to make sure that we give this its required and full and transparent process. Some of the items that council will review as a part of this amending bylaw were raised to administration by our representatives in the development industry, but I do want to stress that this is something that's been a staff-led exercise to make sure that our bylaw is current and consistent, and it's not an avenue for individual developers or builders to propose changes. With all of that said, the report in front of council outlines each of the items and the things that are being amended in detail, and we can go over these item by item if desired. I do have that in the back end of my presentation, but for right now I'm going to go over them in general terms and some of the highlights of the amendments in front of you this evening.
Well, I'll ask, everyone's had an opportunity to review the information. Yep, please continue. Thank you.
Thank you, Your Worship. So the first general set of amendments, and they can be broken into 3 types, are the purely administrative items. These incorporate incorrect references to a section in the bylaw or a page reference, formatting errors in the document where some of the things weren't numbered properly, or as an example of one of the changes, we've added some labels to the land use map to help read it a little bit clearer. These are amendments in the strictest technical sense in that the text of the document itself is changing, but they do not materially add or change anything within the regulations. It's simply corrections. The second major type is clarifications, where staff has added additional details to a section to help make sure that it reads in a clear way and that its interpretation and staff's application of those standards are consistent. So some examples of these are we've added some additional explanation for what a corner visibility triangle is in terms of a reference of height in the area to which that applies. We've added some additional explanation for what is required in terms of authorization of the landowner or landowners with respect to mobile food vendors. And we've made some clarifications in one of our direct control districts to make sure that it's clear whether the direct control district or the general regulations around garages, which one of those govern in those cases. These are different from the administrative amendments because text is actually being added to the bylaw to expand on what was in it previously, but once again, it doesn't change the intention of the rule or how it applies, just gives a clarification to ensure that we apply it consistently. And the final general subset of amendments in front of you this evening are the actual material corrections, where we've made changes to what the bylaw says. And these are incorporated where staff have discovered errors or where the rule does something that we didn't intend for it to do. So one of those items was we intended for the review of development permits for secondary suites and accessory suites to lay with staff, where the bylaw initially read that as being under the review of Planning Commission. So we've made that amendment. We also didn't intend a couple of copying errors that found their way into our direct control districts, so we've corrected those to what the regulations were under the old bylaw and what they should have been. And once again, we're not moving away from the intent with the land use bylaw and what our intended regulations were. We're trying to make sure that what is written in the document properly reflects that intention. All that is to say, and I did mention at the beginning of my presentation, this won't be the last time you hear from us. The land use bylaw was and is always intended to remain a living document. We keep a markup copy in our cubicle pod where we continually identify and flag these things, whether they need additional discussion or clarification, or if they are to go around the next set of housekeeping amendments. And we're also, as was discussed when we initially brought the bylaw forward, working with our building and development industry representatives to establish a stakeholder group to help review the land use bylaw and incorporate input from those stakeholders. Wrapping up, these amendments were presented at Planning Commission on May the 4th. There was some really fantastic discussion around accessory suites and whether that authority should go to staff or to Planning Commission. Ultimately, the Commission was comfortable leaving that authority with staff, provided that they receive an update about those types of applications every 3 months. With that, there were also some questions and clarifications around the amendments identified to Direct Control District 15. And the Commission also recommended some additional wordsmithing around our definition for corner visibility triangles. At the end of the evening, the Commission did vote to recommend this bylaw for approval by Council. I'm going to stop my presentation there. As mentioned, I do have the details of all of the individual amendments if Council desires to go through those item by item, or if Council feels it would be valuable for the members of the gallery to hear some of that. Otherwise, I will sign off there and allow the public hearing to go before we present our Council's alternatives and staff's recommendation.
Thank you, Will. Questions for Will to start off? I just had one. When's the stakeholder engagement group? When do you see that kicking in? Sorry if I missed it in your report.
Not at all. Through the chair. It's staff's intention. We're just working on finalizing a draft terms of reference. It would be our intention to review that with some of our major stakeholders and bring that forward to Council within the next couple of months.
Well, I'm very happy with your definition of a living document. Obviously, when we introduced the land use changes, it was to make it, easier, more accessible for our businesses and our residents to move their projects forward. So I'm glad that we're continuing to look and relook. I like what you've recommended, but looking forward to hearing if any members of the public have a say. So we'll open up the public hearing on B12 2017. This is a bylaw to amend B01 2016. Is there anyone who'd like to speak in favor of said bylaw? Please come forward. Welcome. Sorry, you just need to turn your microphone on. Thank
Sorry about that. Thank you and good evening, Mayor and Council. I'm Marissa Tui from Build Calgary Region, and we're the association that represents the building and land development industry. I'd just like to quickly indicate support for the amendments that administration has proposed and appreciate the ongoing dialogue with them. We look forward to participating in the stakeholder committee that was mentioned, and of course, at the moment, experience implementing the land use bylaw is limited, but as we get more experience and there's opportunities for enhancements, we'll certainly bring those forward for discussion. And with that, if there's any questions, I'd be happy to answer.
Any questions for Marissa? I don't know why we needed to wait for Guy, because you obviously are capable of this postponement that we have this evening.
Thank
but
you. I
we'll look forward to
appreciate-
seeing you both in the near future.
I appreciate the opportunity.
Thank you for coming forward. I'll ask a second time if there's anyone present who'd like to speak in favor of bylaw B12 2017, a bylaw to amend B01 2016. And for a third and final time, if there's anyone here present who'd like to speak in favor of bylaw B12 2017, a bylaw to amend land use bylaw B01 2016. There being none, is there anyone present who'd like to speak against bylaw B12 2017, a bylaw to amend the land use bylaw B01 2016? For a second time, if there's anyone present who'd like to speak in favor and against bylaw B12 2017, a bylaw to amend the land use bylaw B01 2016, and for a third and final time, if there's anyone present who'd like to speak against bylaw B12 2017, bylaw to amend the land use bylaw B01 2016, to please come forward. Okay, there being none, with that, I will close the public hearing and I'll turn it back over to Will. Whenever you're ready, sir.
Thank you, Your Worship. With the conclusion of the public hearing, there are 3 alternatives in front of Council with respect to this bylaw. The first, that Council give 3 readings to bylaw B12 2017. Second, that Council tables the bylaw subject to changes or additional information that may need to be provided for consideration. And third, that Council defeats bylaw B12 2017. Administration would like to see these proposed amendments come forward and to be adopted to help us keep the land use bylaw current and consistent and working as good as it can. And so we recommend that Council gives 3 readings to bylaw B12 2017. And that concludes my presentation.
Excellent. Thank you, sir. Any other final questions? I see no lights on. Councillor Coulson, please.
First reading of bylaw B12 2017, Your Worship.
Thank you. All those in favor? It's unanimous. Thank you, Councillor Haig.
I would move second reading, Your Worship.
Thank you. All those in favor? It's unanimous. Thank you. Councillor Bellick.
Yes, permission for third, please.
Thank you. All those in favor? It's unanimous. Thank you. And finally, Deputy Mayor Burley.
Thank you, Worship. Motion for third reading of bylaw B12 2017, being a bylaw to amend land use bylaw B01 2016 to allow for a number of administrative corrections and clarifications.
Excellent. All those in favor? It's unanimous. Thank you very much. We're going on to bylaws continued. I believe 10.1. I'm not sure who's coming forward for this bylaw. Mike, welcome. Whenever you're ready, sir.
Thank you. Good evening, Your Worship, members of Council. It's refreshing tonight in June to be talking something other than snow and ice, so let's, no questions at the end on that. Tonight I'm here to present, ready to go, is geared towards the commercial traffic in Airdrie and the effects and impacts it has on the road network and a go-forward plan to help minimize the risks and improve the management associated with the movements. So as we know, the city has grown, hold on here, let me get straight. Over the last several years, the city has experienced phenomenal growth. This has many positive effects, but it doesn't come without some challenges and impacts to the road network. As we know, any population growth to a city commonly leads to increased growth of its transportation network. The growth also contributes to increased daily vehicle traffic counts, including commercial truck movements. These commercial movements include the shipping and receiving of goods and the movement of materials and equipment in the construction industry. Unfortunately, there's a downside. The commercial trucking industry accelerates the wear and tear of the road network, which incrementally increases if these vehicles are overweight. Although only accounting for 9% of the total Canadian vehicle traffic counts, commercial trucking is directly related to 25% of all roadway costs. It is determined that pavement damages increase exponentially with increasing truckloads. Damage costs due to overloaded trucks range from 8 cents to $2.50 per ton mile. And these variances are reflective of on the overweight of the vehicle. What is more alarming is the Canadian Transportation Research Board estimated that overweight trucks cost between 160 to 670 million annually in the Canadian-wide pavement repair costs. Consequently, these damages also pose safety risks to the road, such as rutting, potholes, decreased friction factor, and other distresses to the pavement. This is a picture of Main Street in Veterans. Is a perfect example of a distressed intersection, largely due to commercial traffic damage. Because the transportation network plays such a key role in moving goods and people, we need to ensure an action plan is in place that contributes to reducing road damages, focuses on safety and improved efficiency for the industry. So the question is how do we get there? We need to put more emphasis on the front end by monitoring the movements more closely. Currently in Alberta, haul permits are required for all commercial trucks using the provincial network. The permit is only valid for travel on provincial-owned roads and stipulates the hauler must contact local road authorities to obtain permission to travel on roads inside their jurisdiction. It doesn't always happen. In fact, in Airdrie, over the last 4 years, there was only 31% compliance. At present, we have an in-house system that has been operating for 3 years. It's a customer initiated by phone or email during regular business hours. So when a request is generated, the route is reviewed, factoring in road design, road bans, detours, time of day, and current conditional state of the road. The intent is to provide a safe passageway and ensure we are moving our commercial traffic on the roads that are most structurally sound. Unfortunately, with the commercial truck movements continuing to increase and the demand of the industry, it is becoming very challenging to resource internally and stay on top of the movements. In 2016, for example, there were 1,290 Alberta Transportation Highway permits issued with Airdrie as a destination, of which only 668 of those permits were authorized to travel in Airdrie, which is about 52%. That's unfortunate, as compliance is a trend that we want to see on the rise. In an effort to improve the service, administration has been researching other options. So currently, the province operates a web-based program called Travis MJ, which is Transportation Routing and Vehicle Information System, multi-jurisdiction. It's a single window permit application system available 24/7 to the industry that allows for the issuance of a single permit to travel through multiple jurisdictions. There is no cost to join. The municipality enters the information such as GIS, map data, roadway surface types, truck routes, road bans, and geometric designs into the system. The city would maintain the information and fulfill requirements of Travis, such as updates to new roads, bridge limits, construction detours, or any related special permit rules. And once the system is populated with the road information, Travis would use the data to route the carrier, collect an industry user fee, and then issue the permit. In addition, a variable fee based on actual weight times distance of roadway traveled within the city is added to the permit and also collected at time of approval. Overweight fees are defined in the Alberta Commercial Vehicle Dimension and Weight Regulations. For perspective, the urban user fixed fee in Calgary is currently $25, and an average variable fee is approximately $3.09 a permit. So the benefits. Currently, Alberta Transportation is collecting fees on oversized vehicles moving through Airdrie. The city would receive these fees if we were to enter into a fee-sharing agreement with Alberta Transportation. This administration fully understands that commercial movements are the heartbeats to a strong and vibrant city. By ensuring a strong permitting framework is in place that provides a higher level of service for the industry, we are confident this puts us in a better position to protect our infrastructure. There will always be an expectation to our residents that every effort to sustain the overall health of our roads continues to be at the top of our priority list. That concludes my presentation. So tonight, administration is asking council to choose the following. Alternative one would be to give 3 readings to bylaw B15, 2017, being a bylaw to amend traffic bylaw B14, 2016, to allow for a $25 administration fixed fee structure for permitting oversized commercial carriers. And B would be to enroll in the Travis MJ system by entering into the provincial fee sharing agreement. Alternative 2, council could choose to amend bylaw B15, 2017. Or alternative 3, council can choose to defeat bylaw number B15, 2017, maintain status quo and keep the existing permitting process in place. Administration is recommending that council give 3 readings to bylaw B15, 2017, being a bylaw to amend the traffic bylaw number B14, 2016 to allow for a $25 administrative fixed permit fee for overload and overdimensional commercial carriers.
Excellent, thank you, sir.
Questions?
Yes, Deputy Mayor Burley.
Thank you, Worship. Mike, so if we join Travis, is there any way the commercial hauler can circumvent the process and not put in that he's going through Airdrie?
Through the chair, I guess there's always a risk that there's always truckers that try to bypass the scale and can not put that information in. I guess the question is what we're finding now is there's not a dishonesty about where their destination is going or where it's ending. It's part of the problem is we don't have the system in place to allow them to get that permit for Airdrie at the time. So what we're finding is even though there's a destination on the provincial permit, they're not going through the manual process and calling us, because all provincial permits state boldly on them they must call the local road authority for permission to travel on the roads. So there's always the risk that they may not put Airdrie as a destination, but if they're here with a load and they get pulled over and they don't have the permit in place, then they would be in violation.
So there's really no, again, through your worship, so there's really no downside to us joining. We're going to get the benefit of getting the fees automatically then?
One of the, through the chair, the criteria of collecting the fees through the Travis system is we have to have a bylaw in place that says that we have to collect, that we can collect a fee.
Okay, thank you.
Yeah.
Any other questions for Mike? Okay, I think we're ready to go, Mike. Councillor Coulson, please.
First reading, Your Worship, of bylaw B15, 2017.
Excellent. All those in favor? It's unanimous. Councillor Bellick.
Second reading, please.
All those in favor? It's unanimous. Thank you. Deputy Mayor Burley.
Permission for third, Your Worship.
Thank you. All those in favor? It's unanimous. And finally, Councillor Higg, please.
And move third reading of bylaw B15, 2017, Your Worship.
Thank you. All those in favor? It's unanimous. Thank you very much. Thank you, Mike.
Thank you.
Oh, I apologize. Deputy Mayor Burley has a
I just have
question.
one more quick question. Do we need to have another motion to join Travis? That was on your original slide.
No. Through the chair, once we have the bylaw in place, administration can start that process and enter into that fee sharing agreement.
Thank you, Mike. Thank you, Deputy Mayor. Councillor Coulson, 13.1, please.
Thank you, Worship. We have Leonie Esau coming up to discuss the Alberta Community Partnership Grant application.
Good evening, Your Worship and members of Council. Tonight I'm pleased to present a report outlining a regional initiative to create an interim growth plan and accompanying regional evaluation framework for the new Calgary Metropolitan Board. In addition, staff will be asking Airdrie City Council to make a resolution supporting this important project to access funding through the Alberta Community Partnership Grant. The Alberta Community Partnership Grant requires both a sponsoring municipality, which in this case is the City of Airdrie, and partnering municipalities to show that there is intermunicipal support for the initiative. 7 other municipalities in the Calgary region have expressed support for this project, are in the process of seeking support in the form of resolutions from their respective councils. No financial commitment is required by the City of Airdrie to advance this initiative. As the sponsoring municipality, the grant funds will flow through our budget and be administered by City of Airdrie staff. The key focus of this very important initiative is to assemble a team of senior staff from each participating municipality to work with a consultant to draft an interim growth plan based on the principles contained in the Calgary Metropolitan Plan and the accompanying evaluation framework to guide growth in the Calgary region over the next 3 years, while the new Growth Management Board works to create a more robust long-term growth plan by the end of 2020. The goal is to complete this project by the end of 2017, allowing the new Growth Board to consider the interim plan and regional evaluation framework as one of their first items of business in early 2018. Municipal Affairs very much supports this initiative. They, along with the 8 municipalities participating in this grant application, believe that this will set a positive tone for the creation of the new Calgary Metropolitan Region Board. That concludes the staff presentation this evening. I'll entertain questions or concerns from Council and then review the alternatives in the staff recommendation.
Thank you, Leona. Questions for Leona? Well, I think we're pretty good. All I'll say is specifically to our CAO, Mr. Schultz, he's shown a significant leadership role in this process, and I want to thank you specifically for your efforts in pulling the region together and getting this process started, because it hasn't been easy, as we all know. So I really want to thank you, Paul, and yourself, Leona, as well. Please continue.
Thank you, Your Worship. Tonight we have 3 alternatives for Council to consider. Alternative 1 is Council can endorse the Alberta Community Partnership application to fund the development of an interim growth plan and evaluation framework. There will be no impact on the City of Airdrie 2017 budget. Alternative number 2, Council can choose not to support the Alberta Community Partnership application. This will delay and or may cause the development of the interim growth plan and evaluation framework to not occur. And alternative 3, Council can request that staff provide more information on this initiative and the Alberta Community Partnership application. Staff is recommending that Council endorses the Alberta Community Partnership grant application to fund the development of an interim growth plan and evaluation framework to guide interim growth in the Calgary Metropolitan Region.
Excellent. Thank you, Leona. Councillor Coulson, please.
Thank you, Your Worship. I'd like to make a motion to support the project and endorse the application of the ACP grant.
I'm certain this will be unanimous. All those in favor? It is unanimous. Okay, I even put my hand up. Thank you, Leona.
Thank you.
13.2, Councillor Bellick, please.
Thank you. I'd like to invite Sharon up to give us some public engagement results in regards to combative sports.
Your Worship, members of Council, I'm here this evening to provide you with the results of the question that was asked on the Citizen Satisfaction Survey this year with respect to combative sports. So in July of 2016, we indicated that we thought this would be the best way for us to get a gauge on the community with respect to their feelings around combative sports and whether or not they would support combative sports. So as you're aware, the survey was conducted between January 11th and 26th. They had 400 randomly selected participants, and this sample size is statistically significant for the City of Airdrie. So when you take a look at the results, you'll notice that there's approximately 20% of Airdrie households that would say they are likely or very likely to attend a combative sporting event. And so when you take a look at our current dwelling count, that equates to approximately 4,600 dwellings. So when we take a look at the alternatives and implications at 4,600 dwellings saying they would support this type of event, it would fill any facility that we would have here in the city of Airdrie. And so the alternatives is council could direct staff to proceed with establishing a sports commission. This would indicate that council feels there's enough interest in the community to proceed with that. So as we had indicated back in July, there are some costs for establishing a commission and for providing that administrative support until they're up and running. Unfortunately, none of the commissions we contacted were able to actually quantify what that might look like. So the implications on staffing at this current point in time is there's no capacity within the affected units for this particular event that we would be able to accomplish that in 2017. So what we are suggesting is that this could be accomplished through the 2018 budget cycle. And so we could put in for some resourcing to look after that whole setting up of the commission. So one of the things to remember is that these are for-profit events that would be occurring. And there is, if they are held in a city facility, there is an element of risk that the city would undertake. And that's basically because the city has deep pockets. And so although we do our very best to transfer that risk to the promoter, you do still at the end of the day have some degree of risk, and you would be named if should anything occur and there was a lawsuit. The second option would be to have staff approach the City of Calgary with a view to seeing if Calgary would extend their geographical boundaries. We had approached Calgary back in 2016, and at that point, City of Calgary didn't close the door, but what they indicated to us was that would be something that would very much have to go forward to City Council, and that City Council would have to grapple with the idea of their commission traveling to Airdrie, and then you'd have to look into what that fee structure would look like. This option doesn't limit our liability or eliminate our liability, but what it does do is it provides another method for providing a commission. So if council felt they didn't have enough information, they could send us away and ask us to come back with some more information that they feel is missing, or they could choose to accept the report for information, which would indicate they didn't wish to proceed at this time with establishing a combative sports commission. Should council decide to move forward, we would work with corporate communications in developing a communications plan around this. So at this point, when we take a look at the results that came back from the survey, staff feel that what we're recommending is that council provide support for that combative sports commission in principle, and we actually look at this in two ways. So firstly, we approach the City of Calgary and see if they would be interested in expanding their geographical boundaries and letting us just tag on to their combative sports commission. And then secondly, if the City of Calgary was not interested, then we would include within the 2018 operating budget the costs that we believe we would need to undertake to establish that commission and get it up and running until they were operating on their own. And I'm available for questions.
Thank you, Sharon. Yes, Councillor Coulson, please.
Thank you, Your Worship. I still don't understand where private enterprise is in this, and that why they aren't leading the charge. Is it just that because it's Alberta law and it's strictly a municipality thing, that their hands are sort of tied and they're just allowing us to deal with it? Have they offered support or letters of support?
So if council will recall, Alberta is unique in that I believe we are the only province that leaves it up for the municipalities to look after on their own. This issue was also brought forward, if you'll recall, on two different occasions by individuals who, I believe one was a promoter, one was not, who had asked City Council to look into the creation of a combative sports commission. And so this is basically staff responding to those particular requests that came from those two individuals, which resulted in council directing us to look into this.
Right, okay. I have no problem supporting the recommendation. it's just such an awkward role that the city has to play. So I feel your pain in that.
Actually, it'll be not too sufficient if we can get Calgary to expand their geographic network to include us. Deputy Mayor Burley.
So the numbers of financial implications will be included in our budget deliberations for 2017, correct? Or in the fall?
2018, yes.
No, 18.
For 2018,
Yes.
but in the
Yes.
fall. So at that time, we can, even though we're accepting in principle now, we can say, no, we've decided not to because the costs are too prohibitive.
Absolutely.
Okay, thank you.
Sorry, Councillor Coulson.
I was just going to say, this sounds like a great regional conversation to have with Calgary.
Well, we just got some funding from the government. You never know,
There we
right?
go.
Any other comments or questions for Sharon? Okay, there being none, Councillor Bellick, please.
Thank you. So I'd like to make the motion that Council provide support for the Competitive Sports Commission in principle, direct staff to approach the City of Calgary, pardon me, to formally request indicating and including the City of Airdrie within the geographical boundaries. And should the City of Calgary not be interested, include the costs of the formation of a competitive sports commission in the 2018 operating budget for deliberations.
That was a mouthful. All those in favor? That's unanimous. Thank you very much. Thank you, Sharon. We've gone to correspondence 14.1. Councillor Coulson, please.
Thank you, Worship. I think, Sharon, are you going to present about a request of a letter for support from the library?
Your Worship, members of council, you have one piece of correspondence this evening. It is from the Airdrie Public Library requesting support for their CFAP application for matching funds for the expansion of their existing facility. And I believe the amount of the project is just over $113,000.
Excellent. Councillor Coulson.
I'd like to make a motion to provide the letter of support, Your Worship.
Excellent. All those in favor? It would be unanimous. Thank you very much. Thank you, Sharon.
Your Worship.
Yes, sir.
If I may.
Sorry, before we do that, who is excusing the two?
That's not board. This is something to do with correspondence, Your Worship.
Sorry, go ahead, please.
Yeah. I have received an email from the Airdrie Pride Society, and I thought it had went to all of council based on the title in it, but it doesn't look like it did. Could I read that into the record, Your Worship?
Absolutely. So this is because we all received a letter from
Yes, this is from the Pride
Ms. Haig?
Society itself.
Yes, okay.
It says, to Mayor Brown and members of council, on behalf of the Airdrie Pride Society, we formally request that June 2017 be recognized as International Pride Month. We very much appreciate the full support of council as we continue to raise awareness and promote equality within the city of Airdrie and surrounding communities. And it came from the president of the Airdrie Pride Society. So I would like to make a motion that we do declare June 2017 as International Pride Month.
Okay. Any comments or questions? There being none, all those in favor? It's unanimous. Thank you very much, Deputy Mayor Burley. We're up to board reports, and I'll look to my left. Councillor Bellick. Councillor Bellick.
I'd just like to say that with the approach of summer holidays, I would like to just relay to staff and citizens of Airdrie to enjoy their summer, and hopefully nothing bad comes and everyone enjoys the summer holidays, and we'll all be able to see you in the fall.
You know we have a number of council meetings left before I go on holidays, Councillor Bellick. Councillor Haig, please.
Thank you, Worship. I thought maybe I was...
That's like 11 years ago, earlier on. I remember that now.
I don't know if that was a good dream or a bad dream or what was happening there. So I first of all have a motion to appoint Deputy Mayor Burley to the Intercity Forum on Social Policy.
Excellent. All those in favor? It's unanimous. Thank you. And do you want to, just for the audience, just tell people what that appointment is for? Sorry, in case people don't know, because we all know.
So it's a group that meets regularly to discuss social policy in Alberta.
And it's inclusive of the North and the South. Yeah, it's a good mix. Sorry, please
Social
continue.
policy is always inclusive.
Yes, I know. Thank you. Now I'm going on holidays as well, so here you go.
Thank you, Worship. And just I feel I was unable to attend the last meeting. I was in Ottawa, the last council meeting, and towards the end of that meeting, there was a motion that was made in terms of changing council's meeting times and hours, and I believe it was reported that the vote on that motion was 5-2 in favor of that motion. In fact, there was not 5 7 people here to vote on that.
Nope.
And had the opportunity arisen for me, I would have voted against that. And I feel I have to just state that, because when I look back and think about when I was first looking at running for this position, and being a school teacher, and that being my primary job, that there was no way that I would be able to have entertained that had those meeting hours been what was voted for. And so I just wanted to state that I found while meetings go long, that sometimes that's what we do as public officials, and we try to make it so that it meets the needs of all individuals, and extending the opportunity for everybody to participate in the democratic process to the fullest of their ability. And so I just want that on the record, Your Worship. Thank you.
Excellent. Thank you, sir. Deputy Mayor Burley.
Thank you, Your Worship. I have a couple things here. First off, I'd like to make a motion to excuse Councillor Chapman and Councillor Hunter from the meeting.
Oh, they weren't here tonight? Yes. All those in favor? It's unanimous.
And second, with Your Worship attending FCM conference in Ottawa, I was given the opportunity to attend a lot of graduations in the city. W.H. Croxford on Wednesday, Burt Church on Thursday, George Mack on Friday, and Koinonia on Saturday. And one common theme coming out of that, with these grads coming forward, our future's in great hands.
Oh, absolutely.
As well, I attended the Mayor's Run on Sunday in Your Worship's absence. No, I did not run, Your Worship, but not with these knees. Again, it was a well-attended event, and over the last 10 years, they've put between 80 and 90,000 back into the community on fundraising on this.
For sure, Jody's done an
Jody
amazing
and
job.
his group do amazing work.
Yep.
And next thing, tomorrow, reminding everyone, we have the Seniors Week luncheon at TNC.
Yes, I'm looking forward to that. I get to make fun of you, Mr. Burley.
Thank you.
Yes, Councillor Coulson, please.
Thank you, Your Worship. Just to piggyback a bit on that, Seniors Week started this week, and today we attended, Deputy Mayor Burley and I were able to attend the Cedarwood Station fair that they have, which was great. We got to see some potential future candidates in the dunk tank. I'm not going to name any names, but it looked cold, so it was enjoyable. Also, I attended last week the Days Inn hotel opening, and what a beautiful hotel it is. So I would encourage anybody to put their families up in that new hotel as well as many others that we have within our city. I also attended Tim Hortons Camp Day, and I sold more bracelets than the RCMP officer that was there making coffee. Just going to shout that out there. And just, Councillor Haig, I respect what you said tonight about changing the meeting times, but not everybody works a 9-to-5 job. We do have shift workers. We have a lot of oil field homes in this community, people that work away 2 weeks on, 2 weeks off, 1 and 1, some 24 days at a time. So we can't always accommodate everybody. So that would just be, I guess, my opinion, that we have many people that don't work just a strictly 9-to-5 job, and we can't accommodate everybody. We have to do what's in the best interest for the city as a whole, but that was just my opinion.
I did hear that on the tape.
Yeah, good perspective. So just remind everybody, there's a Sean McCann event for Thumbs Up Foundation on Saturday night. I'm just going to open my calendar here, sorry. Get the details. I think it starts at 8 o'clock. It's all the efforts, and his efforts are going to be to bring awareness through music towards mental health, and he's from Great Big Sea. So I think it's going to be quite an entertaining evening. So if you haven't got your tickets, make sure to get them. And as was stated, I was at FCM, and I'll have probably a more detailed report later, but just wanted to pass on there was a gentleman in one of the booths that I guess he saw and recognized me and came over, and he heard me talking to one of the fellows from Scott Builders. And he just said, he walked over and this is really directed to our administration and our great staff, but he said, you know, I lived in Airdrie since '98, and I truly love this community. You guys are doing a great job. So I took that as the people that, and I told him that it's the people that work here that do all the work. And just wanted to pass it on to Paul and let our administration know that regardless of certain times or whatever, it is recognized the great work that they do, and it was just awesome to see. And the guys that I was standing there, they were all other mayors, and nobody did that for them. So it was pretty awesome to see a community member come forward. And from there, I just want to comment about our waste and recycling team. Councillor Chapman will have some comments for you on what they do in Ottawa, and I would say Airdrie is leading the pack. It's really impressive what we're doing on the floor, and I'm looking forward to Councillor Chapman coming in and sharing some of the things that we learned about what they do as a much older city and what we're doing as a younger community. And it's pretty awesome to see. So I just wanted to pass it on. Other than that, we're moving on to Mr. Schultz and ask if there's any of them have any questions for a follow-up.
Through your worship, we're down to a couple items and available for questions if you had any.
That list is getting pretty small, Paul. Any questions for Paul? No. I think we're good. And from there, we've already excused the two councillors. We've done the follow-up, and we are adjourned. Thank you, everybody. Thank you.